Susie, we ready?
Yes, sir, we're ready.
Okay. Good afternoon, everyone. We'll go ahead and get started from May 26th District Board of Health meeting. Roll call, please, Susie.
Yes, Chair. Chair Delgado.
Here.
Vice Chair Lucy.
Here.
Michael Brown.
Here.
Councilman Dare.
Here.
Dr. Novak.
Here.
Dr. Clacking.
Here.
And Dr. Denko should be logging on soon, Chair, but we have a quorum.
Thank you. Move on to number 2, Pledge of Allegiance. District Health Officer, please lead us in the pledge.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Chair, just for the record, Dr. Denko just announced she won't be coming in.
That she announced? She's not.
She's not.
Okay. Thank you. Item 3, approval of the agenda. Can I have a motion, please? Oh, with District Health Officer, any changes?
No changes.
No changes. Can I have a motion, please?
Motion to approve. Second.
Motion from Chief Brown, second Dr. Novak. Trying out this new system. All in favor, please cast your votes.
Aye.
Aye. Put on the machine. We're voting now?
We just got it. It's a little delayed.
Okay.
There we go.
Motion carries. Moving on to item 4, recognitions. District Health Officer.
Thank you, Chair Delgado. I'd like to begin with years of service to recognize William Mountjoy for 5 years of service with the Environmental Health Services Division. I don't believe that he's here today. He's probably busy out in the field. So congratulations to him and thank you for his service. And then we have new hires that we'd like to introduce to the board. And I'd like to begin with asking Mr. Vega if he could, or I'm sorry, let me start with, just want to see him jump up there, with Ms. Dixon to start with introduction of a couple of EHS employees, Zachary Rice and Matthew Simpson. And gentlemen, if you could come down as well, be introduced.
Good afternoon. For the record, Erin Dixon with Environmental Health Services. I'm very excited to introduce our 2 newest environmental health specialist trainees. First, I have Matt Simpson. He was born and raised here in Reno and attended the University of Nevada, Reno to earn a bachelor's degree in Community Health Sciences Public Health. Matt is coming to the health district from the Washoe County School District Transportation, where he worked as a field supervisor. So we are very excited to have him, and I know the school district is very sad to no longer have him. Then I'd like to introduce Zach Rice. Recently joined the EHS team also as a trainee. However, this is not his first time as a member of EHS. He previously worked with our Vector team as a public service intern. He also received his degree from the University of Nevada, Reno in Community Health Science, Public Health. So, thank you.
Thank you. Welcome. I appreciate you. Thank you.
Chair, for the record, it appears Dr. Denko did sign in.
Thank you, Susan.
All right. Then next, I'd like to ask Mr. Vega to introduce Marisa McCune.
Thank you, Mr. Health Officer. For the record, Francisco Vega, Director of the Air Quality Management Division. I'd like to introduce Marisa McCune. She joins us as the Administrative Secretary position in our division. Marisa brings a tremendous amount of experience, which includes in code enforcement with the City of Reno. Is that correct? Parking, yes. But again, we're really excited to have her join our team, and we have high expectations for her.
Welcome. Good seeing you.
Then also we have a couple of retirements, and I see we do have Lori Mendoza. Lori, if you could stand in the back there. Lori's retiring with 28 plus years of experience from air quality as a senior air quality specialist. She started her career here with the Health District back on March 7th of 1994. So best wishes to you. And we do have a small token of our appreciation, and it's not a clock today. We've got a couple of beer mugs for Ms. Mendoza. So we'll present those to her, and I also have a challenge coin to recognize Lori's work with us through the COVID pandemic. She wasn't available when we did the staff recognition event earlier, so I'll have that for you as well. So stick around, we'll take some pictures. And then also Richard Sanchez. Rick Sanchez is retiring after 22 plus years of service. He's not here today, but an environmental health specialist that joined the Health District back on March 27th of 2000. So congratulations to Mr. Sanchez, and best wishes on his retirement as well. Have a couple of resignations. Chantel Batten, environmental health specialist, has resigned effective May 22nd to pursue other career opportunities. And Matt Christensen also resigned effective June 1st for other career opportunities that he's pursuing, both the environmental health specialists in each EHS. And then also today we have Extra Mile Awards presentations to the Reno Aces, and I'd like to have Brittany Aldea step up to provide that recognition. And we have a couple of representatives as well from the ACES, Chris Phillips, Chief Operating Officer, and Olivia Reese, Corporate Partnerships Service Coordinator, accepting the award. And one other person, apparently I don't have my list.
It's on.
Good afternoon, board members. For the record, I'm Dolly, a public service intern for the Public Health District.
I'm Brittany Aldea, health educator, for the record.
We would like to invite the Reno Aces representatives who will be accepting the award to join us today: Chris Phillips, the Chief Operating Officer, and Olivia Reese, the Corporate Partners Sponsorships Coordinator. The Washoe County Health District Chronic Disease and Injury Prevention Program is here to recognize the local organization for providing a smoke-free, vape-free environment for the patrons and employees. We'd like to thank the board for joining us today to recognize them. The Extra Mile Award honors businesses that have gone above and beyond the requirements of the Nevada Indoor Air Act, which creates smoke-free and vape-free indoor work environments for most businesses. The Extra Mile Award representatives have made conscious decisions to adapt policies to further protect the community members from secondhand tobacco smoke and e-cigarette vapor. The Extra Mile Award has been given since 2008, and this year will mark the 32nd presentation for a local business or organization. The business we are honoring today has been identified by our community for exemplifying a growing movement towards increasing smoke-free public spaces. For over 85% of Washoe County residents do not smoke, and there is a growing demand for smoke-free environments. By recently implementing a smoke-free policy, the awardee now provides a smoke-free outdoor venue for hundreds of fans, players, and employees.
Today, it is our honor to present the ACES with the Extra Mile Award. The Reno Aces are a AAA affiliate of the Arizona Diamondbacks. Since 2009, the team and mascot Archie have captured the heart and soul of our community. The Reno Aces are committed to providing our community members the best ballpark experience when visiting their home field, Greater Nevada Field. Further, they prioritize the health and safety of their fans, employees, and players. Leading up to this baseball season, many enhancements were made to the Greater Nevada Field, including the adoption of a smoke-free and vape-free policy for inside of the ballpark. This policy protects everyone who visits the ballpark from negative health effects from secondhand smoke and aerosol vapor exposure.
On behalf of Washoe County Health District, we'd like to thank the Reno Aces for providing a smoke-free, vape-free environment for Washoe County residents, families, and visitors.
You guys have any words you want to share with us?
I'll just say it was our honor and to partner with Washoe County Health District, and everybody that we worked with throughout this process have been extremely helpful. So, right thing to do. We're proud to do it, and thank you very much.
Thank you. Congratulations.
Thank you.
Appreciate the Aces very much. All right, one more round of applause, please, for all the new hires and retirees. Thank you. Welcome to the team.
You get it in two.
Item number
Actually,
5, yes.
Before the Aces reps leave, we're going to have a photo opportunity here in a few minutes if you wanted to stick around for that.
Thank you. Close off item number 4, move on to item number 5, proclamations. District Health Officer.
I sent it to you both ways. Not to you. Sabrina.
So I'd like to begin with a Emergency Medical Services Week proclamation, and I see that we have a number of men and women in uniform, and Sabrina Brissell's with me today, but maybe we could have them all come down to join me while I'm reading the proclamation. So, whereas emergency medical services personnel are called upon to help others through one of the most frightening times of their lives, and whereas emergency medical services is a vital public service with personnel ready to provide life-saving care to the community 24 hours a day, 7 days a week, and whereas access to quality emergency care dramatically improves the survival and recovery rate of those who experience sudden illness or injury, and whereas the emergency medical services system consists of men and women in both the public and private sectors, including emergency physicians, emergency nurses, emergency dispatchers, emergency medical technicians, paramedics, firefighters, educators, administrators, volunteers, and others throughout our healthcare system who work together to ensure those in need receive the highest level of emergency service. And whereas the EMS commitment to patient care throughout Northern Nevada has been an integral factor in our safety and security, and whereas Washoe County is proud to have organizations such as Reno Fire Department, Sparks Fire Department, Truckee Meadows Fire Protection District, North Lake Tahoe Fire Protection District, Reno Tahoe Airport Authority Fire Department, Pyramid Lake Fire EMS, Gerlach Volunteer Fire Department, Ramza, and CareFlight operating throughout the region to ensure the highest quality of patient care and community support. And whereas the members of emergency medical services teams, whether career or volunteer, engage in thousands of hours of specialized training and continuing education to enhance their life-saving skills. And whereas it is appropriate to recognize the value and the accomplishments of emergency medical services providers by designating Emergency Medical Services Week now, therefore, be it resolved that the Washoe County District Board of Health does hereby proclaim the week of May 15th to 21st, 2022 as Emergency Medical Services Week with the theme Rising Through the Challenge, adopted this 26th day of May 2022. Oscar Delgado, Chair, Washoe County District Board of Health. And I don't know who I'm presenting this to, but I will present this to the entire group, and I'll give it to the largest person standing there.
Smart move, smart move.
Thank you, guys. Very much. Thank you.
Amazing. Thank you all for your service tremendously. Appreciate every single one of you. Thank you, thank you. Can we take a quick pic before you read the next one?
Sure.
Can you guys jump into the well? Let's do a quick picture.
Hey.
Yeah.
bad guys on the outside.
This guy's still almost too tall for me.
Chris, better. Oh, switch. Come and slide over this way.
Everybody see me? Over here. 3, 2, 1.
Awesome.
Thank
Thank you guys. Thank you. Yes, sure. I invite anyone who'd like to make comments regarding the Emergency Medical Services Week.
Before we proceed to the next one, Sabrina Braswell, EMS Program Coordinator for the record. I would like to ask some of our EMS partner agencies to speak for a brief moment. Chief Moore of Truckee Meadows Fire and Rescue, would you like to begin? Thank you.
For the record, Charles Moore, Fire Chief for Truckee Meadows Fire. Mr. Chairman, thank you for this proclamation. My agency has approximately 100 paramedics, and we provide advanced life support throughout the community 24 hours a day, 7 days a week. And sometimes it's not just being at the station, sometimes it's being off duty. We have paramedics that are just at large in the community, and one of our success stories is one of our paramedics was training at a local gym. A man went down, went into cardiac arrest. He was assisted by Washoe County Sheriff's detective, and immediately they started CPR and applied a defibrillator. And that gentleman is alive today, living with his family and happy to be alive. So it's that kind of training and those kind of resources in our community that really speak to the EMS services that we provide in Washoe County. So thank you.
Thank you, Chief. Appreciate it. Thank you.
Again, Sabrina Braswell, I would like to ask Chief Dennis Nolan of the Reno Fire Department to join me up here for another brief update.
Thank you, Sabrina. And Chairman, committee members, thanks for the opportunity. Any chance we get to publicly acknowledge the men and women of the Reno Fire Department, we're happy to do. And this 1 week out of 52 weeks of the year where we recognize our emergency medical service providers is, I think by anybody's account, far too little. But our men and women from all the services go out every day and do the job we ask them to do. Of the over 45,000 calls that Reno runs, about 70% of them are emergency medical service related. And so obviously the men and women, the EMTs, the advanced EMTs, and paramedics all have to stay on top of their game. And I think they render the citizens and the visitors of Reno outstanding emergency medical services. While we're here, besides recognizing the people we have in the field, no department really runs without the staff to keep those people trained, certified. And when you think about a paramedic, an EMT and an advanced EMT each have to have 2 certifications, or certification and a CPR certification. Paramedics require 5 different certifications that are all pretty difficult: advanced cardiac life support, pediatric advanced life support, trauma life support. And so I just want to recognize my crew from the Reno Fire Department, our 2 MS coordinators who are sitting in the audience, Kim Eastman and Cindy Green, who are back here. And they're bookending Pete Larson, who is 731's EMS committee chair, who we work very closely with. So again, thank you for the opportunity to recognize our department, the men and women of the Reno Fire Department.
Thank you, Chief. Thank you so much.
Sabrina Braswell again one more time to introduce Adam Hines, the Executive Director for Rumsa Health. And my apologies while he comes up. I did reach out to Sparks Fire, but unfortunately my timeliness of the invite did not allow them to attend. So my apologies to the board as well as to the attendees that they could not be present.
Thank you. Thank you, Mr. Chairman, members of the board. Adam Hines, Ramza Health, and good afternoon. You know, while we are grateful for the dedication and hard work for all of our employees throughout the year, we are extremely happy to have a specific week focused entirely on the important ways EMS professionals in our community contribute to the healthcare here in Washoe County. This year's theme, Rising to the Challenge, is so appropriate, especially over what we have experienced the last couple of years. Ramza Health hosted events, gave away prizes, celebrated individual departments. We welcomed and petted puppies. Leaders cooked food, and we honored our providers and staff at an awards appreciation lunch. I thank our elected leaders and our community members who were able to attend. I know that it was on a budget workshop day, and so those that were attend were very thankful you did, and those that couldn't, I know that you were there in spirit. My colleague, Alexia, is going to share some more about that in her report, but thank you for the proclamation. Thank you for the recognition. Thank you to our co-response partners in the community. This doesn't happen with just Remsa Health. This happens as a system, and obviously the District Board of Health is part of that, so thank you.
Thank you, Adam. Thank you. Any comments from the board related to the proclamation? Chair, Councilman Dare?
Well, somebody has to talk on behalf of Sparks. Come on. So it's an honor to be a part of this region. I think when it comes to our first responders and what you guys do, I'll just tell you, we cheer you on. And I know we get to help make some decisions here, but my prayer and my hope is that as we do that, that it's something that helps protect and stand with you guys and all of them out there. So Sparks, Reno County, Remza, whatever it is, we have so many people. So thank you. Thank you. And we know that it's a big sacrifice on your families as well. In the last couple of years, that's not unnoticed. And so please go home and give them a big hug because they are champions as well. Thank you.
Thank you. Any other ones? And I will just briefly, again, appreciate first responders so much, and just really appreciate how agile, how tactical, how thoughtful you are. It's really a line of freedom that provides for our entire community to be able to go out and enjoy our community and our outdoors, knowing that all of you are so well trained. I don't know how many of you have had a chance. I know I jumped into the river with Reno Fire a few different times on some different types of trainings, and it takes a certain type of a person to have that type of ability, but it's also a security blanket for their community. So thank you all once again. District Health Officer.
Yes, Chair, if you had another proclamation, you want me
Yes.
to proceed with this one and then do the vote?
Yep.
Okay. So this is the National Stop the Bleed Day proclamation. Whereas uncontrolled bleeding injuries can result from natural disasters, man-made incidents, or everyday accidents, and whereas if the bleeding is severe, it can kill an individual within minutes, potentially before trained responders can arrive. And whereas no matter how rapid the arrival of professional emergency responders, bystanders will likely to be first on the scene. And whereas research has shown that bystanders with little or no medical training can become heroic lifesavers. Similar to the use of CPR or automatic defibrillators, improving public awareness about how to stop severe bleeding and expanding personal and public access to bleeding control kits can be the difference between life and death for an injured person. And whereas Stop the Bleed is intended to cultivate grassroots efforts that encourage bystanders to become trained, equipped, and empowered to help in a bleeding emergency before professional help arrives. And whereas Washoe County intends to build resilience by empowering the general public to be aware of the steps that can be taken to stop or slow life-threatening bleeding and to promote the general public's access to bleeding control kits. And whereas it is appropriate to recognize the value of bystander responses by designating a National Stop the Bleed Day, now therefore be it resolved that the Washoe County District Board of Health does hereby proclaim May 19th, 2022 as National Stop the Bleed Day, adopted this 26th day of May 2022. Oscar Delgado, Chair, Washoe County District Board of Health. And I have Sabrina to accept this proclamation. Let me give you that. And would you like to make any comments?
Sabrina Braswell, EMS Program Coordinator. For the record, I just wanted to take this opportunity to thank the board and the attendees for allowing us to do this very important proclamation this year. Much appreciation and credit to the bystanders. I particularly appreciated the phrasing that with little or no medical training, that bystanders can become heroic lifesavers, especially dovetailing off an appreciative week of those who are EMS professionals, knowing that we also can do our part as bystanders to support the heroic efforts of those who are professionally trained. So thank you very much for this opportunity.
Thank you, Sabrina.
So should we do the, some photos? And why don't we maybe start with Sabrina, and then, while she's here, and then get the Aces award next?
Yeah, we take a vote first.
Oh, yeah, go ahead and vote.
Can I have a,
Chairman,
yes?
so moved to accept the proclamations as read.
I'll second that.
A second. All in favor?
Aye.
Opposed? Motion carries. Let's take some pictures.
We
Yeah.
have to push the buttons.
Push all the buttons.
All the buttons.
Dr. Denko, can we get your vote, please?
We all going down to the well?
Can you hear me?
Yeah, we can go down the well. Let's go down the well.
Yes.
Susie, can you hear me?
Yes, we can hear you.
Oh, yes, aye.
Every time she's up here, I hear something. Here we go. 3, 2, 1. Awesome.
All right. Extra mile or Aces?
Thanks for sticking around.
Here we go. 3, 2, 1. Got it?
Thank you guys. Appreciate it.
Thank you. Thank you very much.
Thank you guys for your work. Zachary and then we'll do Rumsa. And then we'll do Mendoza.
Come on, we need your picture.
Come on, come here, come on. Yeah,
Come on, you're gonna put this up on your front room wall, I know. This goes to your living room.
Yeah.
Good thing.
We'll get your picture at
That's
5 and
the
10 years.
profile, right?
Here
we go. 3, 2, 1.
Thanks, man. You guys.
On this picture, we need to send to Washington County School.
Oh, man.
Thank you.
Go. 3, 2, 1. Got it? Thanks. Thank you. Here we go. 3, 2, 1. Got it?
Yeah, we need your beer mug.
Yeah, is it bad luck there's no beer in it?
Thank you very much. Thank you. Thank you very much. It's very exciting. Thank you. Thank you. All right, here we go.
Nancy.
3, 2, 1. Got it?
Thank you.
Enjoy.
Hang on, Lori. There's another one. Lori, we don't want you drinking alone. All right, is that everybody?
Cheers. Lucy's coming back. He's coming right back.
Okay, thank you, District Health Officer. We'll close on item number 5, moving on to item 6, public comment. Susie, do we have any public comment?
No public comment.
We'll close public comment and open up for item 7, COVID-19 update and information, District Health Officer.
Yes, thank you, Chair Delgado. We have seen a continuing increase in cases over the last couple of weeks. So our 7-day average case count now stands at 111.43 cases per day, and that's about 100% increase over the past 2 weeks that we've seen, so a doubling over the past 2 weeks. I think, though, it's also important to recognize that with all of the at-home testing that's occurring, as well as people that are only becoming mildly ill because of being vaccinated or having immunity from prior infection, we have people also that aren't getting tested. And so we're estimating it could be 5 to 10 times that many cases that are happening in the community. So there's a number of cases that are occurring. Our positivity rate is 24%, so that's fairly high as well. The good news, though, is that our hospital burden remains low. So we have 23 patients hospitalized with suspected or confirmed COVID-19 in Washoe County, and that constitutes just about 1.4% of the bed capacity in our hospitals. We're remaining at low in the CDC's COVID community impact level, but because of the number of cases that we're having occurring daily that are exceeding 100, that's straining our disease investigation staff, and so we're using the REDCap system that we've developed to provide text notification for people that we're getting positive test results for them to be able to electronically respond, to fill out a questionnaire, to capture some of the disease investigation information that we do. So that's a capability that we have because of the work we did through the pandemic to develop that. Our call center volume is actually down a little bit this week, but we expect that to increase next month. The FDA is meeting on June 15th to discuss approval of vaccination for children's 6 months to 4 years old, and the CDC is expected to meet soon after that. So we have tentatively scheduled a pod in conjunction with Reno Health to provide vaccinations for that infant age group on June 25th, but that will be contingent on that approval occurring in those meetings. We are continuing to do community vaccination events, and those are going well. We're promoting for people to get vaccinated if they haven't already, to get boosted and to keep up to date on boosters. With the Memorial Day holiday coming up and high school graduations, and recognizing the high number of cases that we do have in the community, we are recommending for people to take precautions to avoid the spread of disease and to recognize that outdoor or well-ventilated settings are the best for those types of gatherings. Therapeutics remain readily available, and our recommendation is for people to call the state hotline at 1-800-401-0946 if they test positive to be able to access the therapeutics. And we had some discussion at the last meeting about the criteria for receiving those therapeutics, and in further discussions with the state, because of the emergency use authorization for those treatments, they have that criteria in that on folks that are at high risk of contracting COVID-19. Those risk elements are quite broad, and they include people that are overweight, which unfortunately is most of us, and they also include include people that are physically inactive. And so from talking with Julia Peak at the state, and the state has set up this 800 number and the free therapeutics for people. It sounds like really if people are seeking the therapeutics, the only people that are being turned away are because they waited too long to contact that 800 number because you need to get the therapeutic treatment within the first 5 days after you develop COVID-19. So I think the availability is still really very good there. And then lastly, I wanted to note that the rodeo is going to be occurring during June. And so we have been working with the rodeo And we will be downsizing our footprint, which is already fairly small, for the testing operations. We're currently testing 3 days a week, Mondays, Wednesdays, and Fridays. And so during the rodeo period, we will have, instead of drive-through testing, we're going to do a walk-in testing where people can park adjacent to the infrastructure that we have built for the testing and walk in, which will reduce further the space that we take and allow more of the space to be available for the rodeo operations. And then we'll revert back to the drive-through after that event is over. So that's my update on COVID-19. Be happy to take any questions.
Yeah, questions from the board for District Health Officer. Dr. Klecken, yeah.
What is the dominant symptoms you're seeing right now?
You know, many of the cases are fairly mild, and so I think what I'm hearing more of is people that are just feeling tired, maybe have a little bit of a sore throat type of thing, but you know, fever as well as in the more severe cases, and cough. But I think we're seeing people that are surprised to be testing positive when they go ahead and test because they just had a slight sore throat for a day or so. So there are those kinds of mild cases as well. So we're recommending people, you know, stay home if you're not feeling well and avoid spreading.
Are we seeing an uptick in other viral?
Yeah, we
infections?
are seeing a sort of untypical increase in flu for this time of year. And so we've seen our flu cases increasing. Last week we had 31 people that were hospitalized with the flu. So typically this time of year we see the flu tailing off because of that flu activity that we're seeing, and we're still below levels that we typically see. We're going to be continuing with our flu reporting, not on a weekly basis, but tracking that through the summer on a monthly basis to stay on top of that.
Thank you.
Further comments, Vice Chair?
Thank you, I appreciate that. District Health Officer, I have a question in regards to what are we seeing in regards to actual numbers being currently tested through our drive-through facility right now?
We've seen an increase in testing demand countywide. It's been up about 20% over the last week, and we've seen a similar increase with the testing that we're doing through the drive-through. But it still remains at very low levels compared to what we've done previously with surges. And last week, I believe Dr. Dow has probably the precise number, but we went over 100 for people tested, which is more than we've been doing recently.
And we had a wonderful presentation from Dr. Krishna Pagila from the university at the Water Innovation Campus with the studies based upon the sewer water treatment and some of the predicating markers that lead to those numbers. Are we seeing that direct correlation with our studies, with those studies that they're coming out of the university, plus what we're seeing at the testing facilities as well?
So it's interesting what they are doing, as well as looking at concentrations of COVID in the wastewater. They're also doing genomic sequencing of what the type of COVID is, and we have seen the BA2 variant and the BA2.12.1, which is the variant that was spreading in the Northeast. We're now seeing that here as well. But what we've seen over the past couple of weeks has been our cases haven't been tracking what the wastewater results have shown. Over the past 2 weeks, the wastewater concentrations have actually gone down a little bit, and we're seeing our cases increasing. So we don't know if there's something that's changed with the way the sample was collected or what, but that's the first time we've really seen that it was coming up as we were seeing our cases rising, but there's something over the past couple of weeks that's not quite matching with what we're seeing for cases.
And so through our PCR test that we're doing at the facilities, my understanding is we don't identify it just shows positive, negative for COVID, but it does not dictate what the variant is, correct, through the PCR test?
So the PCR tests that we're doing on the individual samples that are collected from people, the nose swabs,
right?
Those do not detect the variant. But the state lab is running a subset of those positives for genomic sequencing. But the testing that's coming through the wastewater sampling, where they're running the genomic sequencing on the wastewater, is really the most effective for us to be able to see the variants that are predominating in the community.
Very interesting. Thank you, Chairman. Thank you.
Question, District Health Officer, if you could, recently the governor has dropped the emergency declaration. What does that mean for us at the district Health? And additionally, I know there's something else that's still sitting out there that hasn't been cleared up. Can you provide comment to that, please?
So the state's ending of the declaration of emergency does not have much impact on us. And I think that the remaining area that was continuing to be in effect was Directive 11 that provided some additional flexibilities on how medical services are provided, and some ability, for instance, for some of our MRC volunteers to be providing vaccinations and whatnot. That has ended, and so we're back down to the more traditional scope of practice requirements for those healthcare professionals. There's some impacts that can occur to some testing that the state has been putting out for schools as far as lab licensing, if people are doing point of care type testing. And so the state's working with those facilities to work through that. I think the school district is in good shape because their school nurse, Jennifer Crane, is fulfilling some of the responsibilities that they're required to have for that. But at the federal level, the emergency does continue. And I think that's important for the use of some of the emergency use authorization vaccines and treatments that are continuing to be used.
Councilman Gore?
Yes, so when it comes to some of the lingering things in the law regarding our casinos and some of those things, can you speak to that for a moment? And is there anything we can do as a board to stand up and say, we don't think this is necessary for us, or how does that work? Or?
Yeah, so I included some information in my monthly report, but I can jump into that now, is that under the state's law, and I think it's SB 386 was the follow-on to SB 4. I may be getting that number wrong. They established in there that the SB 4, they established thresholds for when the SB 4 requirements could be discontinued as far as number of cases that were occurring. And because of the increase in the number of cases that we've had, we're over those thresholds. But they also then established that the requirements would end on the ladder of the governor ending the emergency declaration or August 31st of 2022. And so that date, August 31st of 2022, is when the requirements will end for the inspections. But the inspections are scaled down quite a bit now, and we're basically looking for the one-page summary of what the property is doing to reduce potential for COVID spread, to be posted at the employee entrance, that hand washing sinks are available for hand washing and are stocked throughout the facility, that the employees are cleaning high-touch services on a daily basis, those and their sanitizer in the facility. So it's a minimal set of requirements really that are in effect right now. And that's really cut down our time that it takes to do the inspection.
The one that I thought was very hard on them was the elevator.
The elevator is no longer a requirement,
Okay,
other than cleaning the buttons
Good
in
enough.
the
Okay,
elevator.
thank you.
Yeah.
Chief Brown? No? You down? Okay. Gotcha. Any further comments? Seeing none, we'll close item 7, move on to item 8, consent items. Susie, do we have any public comment?
I just wanted to note that Dr. Denko's in. I don't know if she has a part in this report as well.
Sure. Dr. Danko, any comments?
Not too much, just highlighting what Kevin reported. You know, we have to continue to be cautious, and we're definitely seeing a steady stream of COVID and also a steady stream of complications from COVID-related infections as well, both in the hospital and in the post-acute settings.
Thank you, and my apologies, I didn't look up. Any comments for Dr. Danko? See none. Thank you, Dr. Danko and District Health Officer, for the update. We'll close item 7, move on to item 8, consent items. Susie, any public comments on consent?
No public comment.
No public comment. Does anybody want to pull any items from consent? District Health Officer?
Yes, on the consent agenda, I just wanted to note for the board that the item BI is an agreement between the Washoe County Health District and Truckee Meadows Tomorrow. And this is under $100,000, so it's under my authority to approve. But I am on the board of Truckee Meadows Tomorrow. And so I wanted this to come to the board for approval. The Truckee Meadows Tomorrow board voted to approve this agreement. I abstained from that vote, and I wanted to just to make that clarification for the board.
Thank you for that disclosure, District Health Officer. Anybody want to pull any items from consent? Seeing none, I'll look for a motion. Dr. Novak? Second, Dr. Clacking. All in favor?
Aye.
Any opposed? Please submit your vote once it pops up. Oh, it doesn't? Okay.
Oh, it does on yours.
Yeah, we're good. We're good. So we'll close item 8. Moving on to item 9, appearance. Scott Oxnard, this is a big one for the board. A few months, almost a year ago, I want to say. It's been a while. We were directed by a regional committee to change our name. And I believe Scott's going to give us a little bit more briefing as to where we are now.
That's correct. Chairman Delgado, board members, Scott Oxnard, Communications Manager for the Washoe County Health District. So I'm here to introduce Nicole Dion and Kyle Bryce from Estepona Group regarding the name change to the rebrand of the Washoe County Health District. Before I do, I did want to recap just kind of how we got here and what we're kind of looking at from you all today. So during the pandemic, there was appetite from some board members and other elected officials to consider a name change, one that gives the Washoe County Health District some autonomy and individuality. And rightfully so, as we serve everyone in Washoe County, as our board is made up of members of the cities of Reno, City of Sparks, and Washoe County. Last September, I was here. I presented some strategies to the board for a possible name change. The direction that you all gave me was to proceed with that, to hire a firm to help us get to a place where we can get members of the public involved, get stakeholders from the community involved to come to at least get some feedback from them in terms of a name and where it would go, and also bring back options to the board along with a recommendation from the firm. So that's exactly what we have for you today. Estepona Group is based in Reno. They've been around for nearly 30 years here. They were chosen based on their experience in brand development and strategy. A couple examples, they performed a rebrand of a public broadcasting channel, formerly KNPB, and that changed to PBS Reno. They also did public health brand building for the COVID-19 pandemic for Immunize Nevada, which included the 3 Million Reasons campaign, the NV COVID Fighter website, and Vax Nevada Days. Branding is what they specialize in, so we were very comfortable with bringing them along, and I just want to say for the record, they've been very helpful, thoughtful throughout this whole process. So with that, I'll pass it along to Nicole.
I'm short. Good afternoon. For the record, Nicole Dion, Account Director with Estepona Group. Over the last 6 months or so, we've been working with the Washoe County Health District to explore alternate name options. And our process for that was, I don't know if we have the slides. Okay, we do. Great. Love it. It's a great process. Perfect. Go ahead and go to the next slide. Thank you.
You have a clicker right next to
Oh,
you.
awesome. Is it? I see. What am I doing wrong? Which way do you point it? Got it. Okay, so our process for that was we had an initial planning meeting followed by a discovery meeting with the naming committee. The naming committee was comprised of Chair Delgado, Health District Officer, want to make sure I get that right, Kevin Dick, and Scott Oxrart. From there, we developed a creative brief, received committee approval on that, and then moved on to several internal brainstorming sessions, which we developed a very long list of name options. We whittled that down to our top 11 choices and floated that to the committee for review. We received committee feedback and then came back with a new list of 10 options for consideration. We then met again and settled on our top 5 name choices, and they are Northwestern Nevada Public Health, Truckee Meadows Public Health, Northern Nevada Public Health, Public Health of Western Nevada, and Washoe Regional Public Health. Once we had our top 5 names, we set out to gather public sentiment in the form of focus groups. We had 5 total focus groups with 31 participants. 2 of those focus groups were considered internal. One was with Washoe County Health District staff, and the other was with Joint Information Center members. 3 of those were external focus groups, so with the general public. 2 of them conducted in English and 1 primarily in Spanish. All focus group participants were Washoe County residents, and each focus group had between 5 and 10 participants. The exception of that is the Joint Information Center focus group, which had Rebecca Venus with the City of Reno, Julie Dwell with the City of Sparks, and Bethany Drysdale with Washoe County. It was great to have these 3 professionals involved in the project as they bring a lot of experience with communicating with the public and elected officials. As for our participant makeup, we did our best to get a mix of age, gender, race, and occupation. However, we only gathered gender data and did skew female. This slide has a selection of focus group participant industries and organizations. Industries is shown on the left-hand column, and organization is shown on the right-hand column. I just wanted to note this is a sampling and not inclusive of every occupation from every individual. Before and after each focus group, we surveyed participants and asked them to rank the names on a scale of 1 to 5. This slide aggregates all focus group data, with light blue representing before and red representing after focus group survey results. Before the focus group, you can see that Washoe Regional, Northern Nevada, and Truckee Meadows were mostly neck and neck. And then after the focus group, Washoe Regional was a clear winner, with Truckee Meadows in second place. Turn to you.
For the record, Kyle Bryce. So with the focus groups, we wanted to focus on understanding the preconceived notions that the participants may have and try to uncover biases that we could potentially address with this rebrand. Moving into our Google survey, we actually wanted to do the opposite and keep it as unbiased as possible. The way that we did this was completing an anonymous survey. So respondents were anonymous and the person hosting the survey was anonymous. We used Google survey, which you'll probably have seen in front of RGJ articles that are gated. People take those few quick questions and they get to their content. There were 5 total survey questions. Each of those questions had all 5 names listed, but they were randomized for everybody who participated in that survey. So we didn't have any skews from being at the top of the list or at the bottom of the list. We got nearly 350 total respondents, and we opened it up statewide, again, to avoid regional biases. We did skew almost 50-50 male and female, and as you can see, we tried to hit every age range possible to create as much diversity as we could in an anonymous survey. The first question we asked was, which of the below organizations do you believe has the most authority over public health in Reno and Sparks? When we highlight that geo modifier, Washoe Regional Public Health came out on top with 43.2% of all survey respondents selecting that option. Option 2, we remove the geo modifier, asking which organization name best represents the mission of protecting public health and safety. This time, Washoe Regional Public Health did still finish first, but the close second was Northern Nevada Public Health. For question 3, we asked the inverse. Which organization do you feel is the least impactful at protecting public health and safety? This time, Public Health of Western Nevada was selected as the least impactful, but interestingly, Washoe Regional Public Health came in second this time. The name that performed the best was actually Northern Nevada Public Health. Question 4, we looked at the rural regions the district represents. Which of the below organizations do you believe is responsible for public health and safety in rural communities like Gerlach? Northern Nevada was a clear winner there. And question 5, we finally divulged who was putting out this survey, asking, if the Washoe County Health District were to change their name, which name do you like best to represent the organization's mission? Which again, the clear winner was Washoe Regional Public Health with 41.8%. Followed by Northern Nevada Public Health with 21.3%.
Thank you. So over the next 5 slides, we have some summarized focus group anecdotal feedback. First up, Northern Nevada Public Health. Participants liked this name because they felt it was inclusive of all of the regions the health district serves. But at the same time, they were worried that it might imply the health district serves all of Northern Nevada, including Elko, which they do not. We also heard from some, though, that many consider Washoe Northern, Clark Southern, and everything else rural. As for Washoe Regional Public Health, people liked that it was a nod to Washoe County without actually saying it, but at the same time thought it might not be different enough from Washoe County. Some did say they thought it could be redundant with Washoe being a regional term as well. And then we heard from one focus group participant that they were concerned about the word Washoe having cultural appropriation with indigenous language. But we did speak with the Reno Sparks Indian Colony, and they let us know that they don't see any issues with that. Some focus group participants said it made them think of a hospital or a clinic name, and others did bring up Washoe Med. Northwestern Nevada Public Health, they felt it was technically the most accurate description of the service area, but at the same time was quite a mouthful. And we found across the board that directional language was very confusing with our focus group participants. Some also thought there might be some confusion with brands that have Northwestern in the name, such as Northwestern University. Truckee Meadows Public Health was a favorite among our public focus group participants. However, our Spanish-speaking audience was vehemently opposed to this. They thought it reminded them of the town of Truckee, California. Also, many people said that Incline and Gerlach do not consider themselves part of the Truckee Meadows. Some also noted there might be some brand confusion with Truckee Meadows Fire and other organizations that use Truckee Meadows. Public Health of Western Nevada, again, they said it describes the service area, although not entirely accurately. And then, again, directional language caused confusion.
So based on the findings of our focus group and surveys, Estepona Group has brought 2 options to the board for your consideration. Option A, we consider strong and wide-reaching, Northern Nevada Public Health. It puts the organization toe-to-toe with the Southern Nevada Health District and is perceived as superseding other regional organizations, such as Washoe County, the City of Reno, or the City of Sparks. Option B, we do consider safe, but geographically inclusive. Washoe Regional Public Health. This is inclusive for all residents served by the health district. It's specific in where the organization has authority, but also recognizable for those currently familiar with the health district. So with those for your consideration, I will turn it back to Scott for next steps.
Thank you both. This is the most engaged I've had you guys on any communications related aspect, so really appreciate this. Just as a reminder to follow up before I toss to you guys for discussion, if the board does recommend a new NEM today, the recommendation would become a proposed amendment to the interlocal agreement, which would then be presented at the next concurrent meeting. So we're happy all to take any questions that you might have.
Great, thank you. Back to the board. This is a directive that was, again, brought to us from a joint meeting between all three jurisdictions. They put in tons of work. Very proud again. Thank you to Subpoena Group and to our team, our staff, and to all the public that participated. 350 responders is pretty good. It's a solid reflection of our community and also the diversity of ages. And thank you for doing that community outreach. We'll bring it back. Vice Chair Lucy.
Thank you, Chairman. I do appreciate the opportunity to speak today. Can we bring the slides back up from the presentation, if possible, so we have kind of some reference to the names? Thank you. Appreciate that. Perfect.
Do you want five or do you want
this is
these
fine.
two?
No, this is fine. This is perfect. This is actually where I wanted to go, anyways. I want to recount a number of the issues that were brought forward in the concurrent meeting, were that Washoe remained present in Washoe County Health District, and the reasons for that, it forced individuals to attend meetings that were confusing and didn't know really where the reliance really led of where the issues need to be conducted at. And so, from my opinion, the Washoe Regional Public Health doesn't really address the needs and concerns brought forth from all three entities of changing the name to provide for a overall separate structure and entity, and that was kind of the necessary driver of the conversation. The only other concern, so in that sense, I'm obviously leaning towards Northern Nevada Public Health from my standpoint, but as my role as the president of Nevada Association of Counties, the challenge that I see with Northern Nevada Public Health is that many of our surrounding counties, such as the Quad counties down south, have a health district. There is to our east, Churchill County, Pershing, Mineral, and Eureka are in the current pursuit of constructing their own Board of Health amongst their counties. And I have some concerns that Northern Nevada Public Health might create that concern as well from a statewide issue. However, what I would say in support of Northern Nevada Public Health is that realistically, our Washoe County Health District has been the go-to and primary responder for many of the individuals across the rural parts of Northern Nevada. We really are the point of contact. And so I think our health district really starts the lead in Northern Nevada, but really isn't the end-all for Northern Nevada. So with those comments, Mr. Chair, I would support Northern Nevada Public Health going forward as a recommended name change. Thank you, sir.
Thank you for those comments. Councilman Dare.
I'm going to agree. Having Washoe in there in our meeting, it just, all the exercise of everything we've done doesn't make any sense because the confusion, and I appreciate what you walked us through because it gives us things to think about as we go. I do have one question though. Could we just call it regional public health? If it's in our area, people know where it goes. And with that said, it takes away the confusion of, because so he's talking about NACO. I'm been lead and president of Nevada League of Cities. You're right, Northern Nevada. I have cities all over the place that are not part of our group in Northern Nevada. They consider themselves Northern Nevada. So, but if we're trying to hone in on a region, like an actual name of it, then we have to keep Washoe because that's the only thing that makes sense. But we are saying that's a problem. So the only question I have is, it's in our area. We direct people to it. Why can't we just call it regional public health? Because that's actually what it is. Maybe I'm crazy. I don't do your job. So I'm not even trying to act like I do your job. But if I had to choose one of the two, I would go with Northern Nevada. But I think the very thing we're trying to do does do things for other counties, definitely for other cities. And, well, they'll just make fun of us because they'll be like, what are those people doing over there? I'm not in that. So just my thoughts.
Other comments?
I
Yeah.
can give you a little bit of clarification based on your question. Again, Kyle Bryce for the record. We did find that the users that participated in our focus group leaned towards wanting some sort of geo modifier to be able to understand where the authority of the district was, which is why we included that Washoe Regional Public Health. But a good point that you make is regional public health with the right tagline, as you can see on the option A, serving Reno, Sparks, and Washoe County could include that geo modifier as a tagline. So definitely an option for you guys to consider.
Yeah. Dr. Clacken, were you?
Yeah, I just have a couple of quick questions. First of all, this contract was, or involvement was done before I was on the board. I heard about it. But is it just for a new naming, or is there a marketing component to this too?
Great question. Scott has that.
Thank you, Dr. Clacking. The contract was solely just for the strategy to come up with options for you guys for a new name. And then the thought behind it is when we do agree to a new name, then going out to bid for more of the outreach portion and the marketing and the rebrand which is a much larger, considerable project.
Okay, so this, and the contract was around $150,000, I think, correct?
This one ended up, I think it was 30.
How much?
$30,000.
Oh, okay. I was
Close.
misinformed then.
Yeah. Thank you. Any further comments? Being part of this exercise, it opened my eyes up to quite a few things. And to the vice chair and council member, when I saw Washoe Regional, that was just something that I think people in the community were just used to hearing. And so for them, it was, they wanted to test it and see how it goes. And again, but in many different ways, it goes against everything for why we ended the exercise, right? And that was a conversation we had quite a bit around. The Northern Nevada Public Health just started the tagline, the subtitle underneath, serving Reno, Sparks, and Washoe County, I think would suffice to understanding geographically what we're doing. And I just look at our constituents in Washoe County. Of course, we are rural partners and our friends there. I think more often than not, we provide an opportunity and service them. But the exercise was focused on our constituents in Washoe County and for them to better understand where the services are that lie within our geography. In my experiences, I see, Nevada in many different ways is broken into 3 different segments as shared by the JIC, and that's Southern Nevada, Clark, Northern Nevada, Washoe, and rural, the rest of the state. And so, but again, I think that subtitle and the campaign moving forward in terms of identifying and saying serving Reno, Sparks, and Washoe County would suffice the community to better understand who we are in terms of Northern Nevada public health. Felt comfortable with option A anyways. But again, we had 5 options. This was recommended by a subpoena group. If there's some other options that you guys would like to bring about, we can do that. If you guys want to continue this item to another day and bring about some of those other names, we can do that as well. But I know this is something that was directed by, for our team to go out and work with that subpoena group. And just wanted to bring it to all of us to have a discussion around. So if the job wasn't done, we'll go back out and do it again. However, we have some really good options in front of us, I believe, to make an option.
Chairman?
Yes, Vice Chair.
Thank you. One other option that we were served by the Espetina Group was the Western Nevada, knowing that it did not score very well with the focus groups. However, Western Nevada does alleviate some of the challenges to those cities and counties to the east of us, and really does Washoe County, even though we may not have a service area up to our very northern portions of the county, and we do represent directly here within the broader base of the southern tip of the county. Realistically, Washoe County as a whole identifies a good majority of the western border of the state. So from my standpoint, the Western Nevada Public Health is really more in tune with the geographics. It's more in tune with the intent of the reason for the name change, and then really gives the autonomy to the board without having that challenge to it. So I would feel more inclined towards Western Nevada, still understanding that Northern Nevada Public Health serving Reno, Sparks, and Washoe County is phenomenal, but very wordy and very heavy. And so when you talk about branding and different things of that nature, when you start adding a number of words to things of that, it makes it, one, costly, two, challenging to do. But Western Nevada is very blanket. It's very, innocuous, but it gives the autonomy. And I don't think really it drives, what it does is it addresses the current issue, which is creating that autonomy for this district and the ability for us to stand alone through our own interlocal, knowing that Western Nevada is really, outside of Reno, Sparks, and Washoe County, there isn't many until you get to Churchill or even Winnemucca, which don't consider themselves necessarily Western Nevada. I think really identifies who we are, and it gives us that geographical fence that we were looking for. Thank you, Chairman.
Yeah, Councilman Dare.
Western won't fit on that sign. I'm just kidding. But I would say this, though. I still would like to throw out there, because I think serving Reno, Sparks, Washoe County, and even when it comes to branding, adding a fourth word it's a big deal, actually. It does change things. So having regional public health or something public health or something, and so maybe going to the drawing board if you had to. I'm not trying to get you to do that. But I'm saying I'd like us to really explore that, because as you add more to it, I don't care really. I can tell you that what he just said would work if we feel like we have to have that in there. But it does seem long to me. And then, I think we're going to cut it down to 4 letters anyway. We're going to end up saying, we won't call it that whole thing as we do our branding. But so maybe that's something to think about. But I do think that it would make sense if we said, hey, this is regional public health serving Reno, Sparks, Washoe County. I don't know why anybody would be confused on that, but I'm not pushing. To me, I think either one would be fine. But I don't like Washoe. I like Washoe. I don't like Washoe in the name.
Yeah, you're on the record, Chairman, Councilman. Dr. Danko, any thoughts? I can't see you, so I just wanted to make sure I reached out.
Nope.
Okay.
I'm good. Thank you.
Okay. So, yes.
Thank you, Chair. On Western, is it still on? Yep. I think. Oh. I want to go back to that slide so we have it up. We had someone from EDON in our focus group. Oh. Some weird cursor stuff going on. Okay, yeah, we don't actually say it on the slide, but the representative from EDON said that they are constantly explaining to people what Western Nevada is and that they want to change their name because it is such a problem for them. So I would just caution you against that.
Chairman, my only comment to that would be that economic development of Western Nevada has a different, broader base. They are seeking out individual companies outside of our region to come to our area. So understandably, for an economic development that's only focused on the Reno Sparks area, yes, I could see that focus. But from a statewide and regional agency, I don't think Western Nevada really impairs the ability to identify who we are from our client base and who we serve. So I would make that differentiation between the two, because it's not really. We have an obligation to the community to serve public health. They are more of a retention agency going out seeking business. So it's a different motive and a different narrative.
All right, any other thoughts? I think we'll take a vote. I'm still, for some reason, I like Northern Nevada. But let's, unless the item wants to be continued by anybody, seeing none, we'll vote. We'll take a vote. We'll take a stab at it. No harm feelings. Let's go for it. Can I get a motion from someone into?
Chairman, can I make a motion?
Yeah.
Chairman. Based upon the discussion today and understanding the constraints and the challenges here, I would make a motion that we move forward with the name change of Washoe County District Board of Health to the Western Nevada Public Health Board.
I have a motion. Do I have a second for Western, what was the name? It was,
Western Nevada.
Western Nevada Public Health.
This one?
Oh, Public Health of Western Nevada.
Public Health of Western Nevada, there you go.
Okay, so I have a motion. Do I have a second for that one?
All right.
See no second, motion fails. Do I have another motion from the body? I will make a motion that we move forward with the name change to be called Northern Nevada Public Health.
See, that's changed. It's changed. Oh, yeah, there's two
So-
Northwest. Oh, the Northwestern, that was the college.
So I put a motion, Northern Nevada Public Health. Do I have a second? See no second, motion dies for Northern Nevada Public Health.
If we're doing this, I just say you don't. I don't love either of them, and because of what they do, I say that. So I don't know that I love either. Either of them are fine. So I mean, in a sense, but do we want fine, or do we want a name that we can say yeah? And that's the only thing I'd say. So I'm not like.
Dr. Novak.
I kind of agree with Chris. I really don't have a strong feeling either one of them. If you go with a recognition around the country, Southern Nevada is definitely known for public health around the country. Going with Northern Nevada, it basically says, okay, you're here, we're here. It's a regional marker. I don't have a problem with either name one way or the other. So this is not a matter of seconding because I just don't have a strong enough opinion either way. It's going to cost us, $1 million to change this when it's all said and done, so.
I totally understand. We're going to have to vote, though.
Okay,
So
well,
unless we're going to be here for a while, unless you guys want to kick it out. So
Well, I'll second Northern
Gotta have a
Nevada.
thought.
I'm going to second Northern Nevada, and here's why. I think you just said something that made me think of this, because I'm down in Vegas often right now, and I can say that they do get a lot of marks of what they do, and I think we want to make our mark, and I think that might give us a little bit of we stand up with Southern Nevada and say, hey, okay, if you're Southern, we're Northern, and let's rock and roll. So obviously this is our board, and then it comes to us as a larger entity, right, after this. So I'll second the Northern Nevada. I think I'm more comfortable with that personally.
I'll go with that.
So I have a second for Northern Nevada. Discussion. Public comment with the tagline.
The tagline has to be there.
Well, correct me if I'm wrong. The tagline, further campaign conversations or anything else will come back to us with review once that goes out to RFP for another firm to put a package together and so forth, right?
No, we would recommend that the tagline that
stays
you
there?
guys see in the recommendation goes with the name
Okay.
presented.
Great, okay. So I have a motion, second discussion. Public comment? None?
No public comment.
All in favor?
Aye.
Here it comes. So the public can see. Does it pass? Boom. Congratulations, new name change. Northern Nevada Public Health, looking forward to the campaign. Thank you all for your hard work. Thank you, thank you. All right. Oh, and my apologies, Dr. Clacken. I see that did you want to speak on something? No, I'm sorry about that. Okay. Closing off item 9, moving on to item 10, Ramza, review and acceptance of Rimsa Health Operations Report. Mr. Dean Dow.
Good afternoon, Mr. Chair and Board. My name is Dean Dow, President and CEO of Rimsa Health and Carefully for the record. You have our copies of our April compliance report, and happy to answer any questions you may have.
Any questions for Mr. Dow? Can I get a motion, please? Motion. Councilman Dare, second. Dr. Novak, all in favor?
Aye.
Aye.
Any opposed? Motion carries. 10B, public. I'm just going. I don't see in front of me. Go ahead. It's a little delayed. The vice chair informed me, so we're just kind of
Super delayed.
going. So it looks like it accepted, I'm assuming. Okay. Yeah. Gotcha. Okay. Ms. Jobson, good to see you.
Good afternoon, Alexia Jobson, Director of Public Relations for Ramza Health. For the record, you have for your review the Public Relations report for April, and today I will share some more recent activities that will focus on our recent EMS Week events. In celebration of how all employees contribute to the care we provide, each day of EMS Week recognized a different department within the organization. In addition to the organization-wide events we hosted, each department received a division-specific gift or event as well. Ramza Health was fortunate to secure more than $10,000 in cash equivalent, or in-kind donations from community organizations, businesses, and vendor partners. We are deeply grateful for their generosity. Some of our top contributors were Greater Nevada Credit Union, who hosted a food truck and games at the Edison Way campus, as well as the Employee Family Bowling event at Kingpin Club at the National Bowling Stadium. KPS3, which sponsored the Employee Awards and Appreciation Luncheon event, where we distributed 15 awards and about 60 certificates of recognition. Reno Elks, who supported the Employee Prize Wheel. Nevada Donor Network, who sponsored the Fry Yay Barbecue event, where we hosted co-first response and EMS community partners. And Donor Network West, which sponsored the Care Flight Ground Barbecue and Awards event in Plumas County. In addition, Pause for Love Therapy Dogs visited the Edison Way campus and rode out with a supervisor to visit crews in the field. Twice during the week, our ground operations, dispatch, and clinical leaders hosted made-to-order breakfast burritos and grilled cheese sandwiches. On one of the system's busiest nights, we were able to deliver pizza to the night crews out in the field, and once the system stabilized, we rotated a few units through. Executive leaders met up with crews where they spend their time during their shift at the hospitals. They rounded with providers to deliver refreshments, chat, and answer questions, and most importantly, express appreciation for the work the providers do. We are grateful for the dedication and hard work of all of our employees throughout the year, and we are happy to have a specific week dedicated to EMS professionals. I'm happy to answer any questions you may have.
Comments from the board?
Thank you.
Thank you. With that, we'll close item C. Moving on to item D, discussion possible approval of Ramza requests.
Chair, we're moving to C.
Oh, did I group? Sorry. I'm item C now. Thank you. Mr. Dow and Barry, good to see you guys.
This is item C, correct?
Correct.
Okay. Chairman of the board, Dean Dow, President, CEO of Rimsa and Careflight, for the record. As we all know, the Emergency Directive 11 has been discontinued by the governor's office. And with that, there was discussion pre that event to the effects potentially of how Rimsa Health is delivering health care in a tiered system within Washoe County, as that was developed through the oversight, if you will, of the emergency directive. So the DBOH has asked our joint advisory committee, which is represented by Rimsa Health, Reno Fire, Sparks Fire, Truckee Meadows Fire, Reno Tahoe Airport Fire, also participation from PMAC, to facilitate EMS oversight team to form a work group to review our tiered response and some other temporary system innovations that were put in place as a result of the governor's emergency directive. Recently, the group has met multiple times, April 13th, May 11th, and then just yesterday, May 25th. The summary of the activity is each member was asked to discuss with their respective agency, to ensure that there was support to moving forward with evaluating the current franchise verbiage related to Article 2.3 and the value of a tiered response. The JAC proposed and the members supported a 70-day extension, which allows for tiered response to continue within the current constructs while the JAC evaluates item 2.3 of the franchise and works on potential proposed amendment wording which we hope draws consensus, and we will look forward to bringing that before the DBOH for their input and approval in the upcoming July 2022 DBOH meeting.
Thank you, Mr. Dow. Questions from the board? Don't see no one that wants to say anything. I'm looking around.
I got a question.
Yep.
So
Councilman.
so we're going to extend what we've been doing now for 70 days.
Yes.
Is what we're talking about.
Yes, sir. Mr. Dare, the request is to extend for 70 days to give the JAC and PMAC a little bit more time to put the wording together. Also, we want to look at some additional data and build some dashboards, if you will, to make sure if we move forward that everyone in the JAC can see the positive aspects of this as far as patient care is concerned and servicing the community.
Okay, just one clarification. Thank you.
You're welcome.
Thank you, and I too have heard that they've been very productive. Mr.
They
Dow.
have.
So,
They've, as I indicated, these meetings generally are running at least over an hour, if not close to 2 hours, and very, very good participation. A lot of good ideas have been brought forth.
appreciate everyone's involvement and just making sure we get it right. So look forward to hearing feedback from the committees. Chief Brown.
This isn't an action item.
No.
You're asking for us to approve the 70-day timeframe, or is this just advising us you're going to go to the 70 days?
Chief, I guess it would be advising that we're asking for 70 days and then reporting back in the July 2022 DBOH meeting.
Since we can't do that, that's not set up that way. Dana, would we ask that they come back to us next month, minus 30 days? Or is that a retroactive, or can we work with legal on that?
This would have to come before the board as an action
Sure.
item, so the board can't take any action today on this item.
Okay. So, that's, well, I think there's the understanding that you guys are working with the group, with the parties on a tiered system. Mr. District Health Officer, with respect to compliance from Ramza and working with us, I believe there may be an opportunity for maybe a letter to be submitted in terms of what that may look like, and then an action item come back next month
We can do that.
state that we're within
We can
the
work with the
confines
health
that there's a
officer.
working conversation taking place and so forth.
I guess I would look to legal counsel, but I think we're in a little bit of no man's land right now, because the franchise agreement, for it to be amended, it through our interlocal agreement for EMS oversight, that requires that each of the jurisdictions be involved in those concurrent discussions. And so I don't think that the board is in a position to make any changes to the franchise agreement until those discussions are concluded, that Rimsa would be then working with us to bring back as a potential amendment to the franchise agreement. So I think this is really more informational, that that work is occurring, and it's probably going to be the July meeting before that they come back with the results of those discussions and the proposed language for an amendment to the franchise agreement. And I would, I guess, defer to our legal counsel if there's a different take on that.
I don't have the agreement in front of me, and of course, I'm just now presented with this question. However, based on my prior review of the agreement and prior discussions that we've had, that is the general process and what is required. Certainly today, there's no action that can be taken regardless, because this is not an action item. So there's going to have to be a process subsequent to today's meeting before this board has any authority to approve any sort of change or modification to the current requirements of the interlocal.
Councilman Dare.
If it's something that's necessary for, I mean, the one thing that we want as a health board, and to say this loudly, is make sure that.
I don't think your mic's on.
There you go. Make sure is that we have a significant role in this conversation. And I say that even as a city councilman, I get our roles. However, which comes first, and I think one of the things we're trying to do, even as city council and my mayor saying, well, the health board tells what you want to do. So if we're not careful and we just say, oh no, just send it back, then we are removing ourselves out of the decision conversation a little bit. Now, with that said, there's a balance in all that. But could it be potential that we throw another meeting in and do a special meeting just to talk about this and get this agendized so we can get it done right? So we can get it done, have our stamp on it, and then we could move forward, and that could take 2 weeks, I think, or whatever, to put it out there, and then we could do it correctly. And I only say that to make sure that I think the health board is significant in this conversation as ever, making sure we do it right. And then it does need to come to us. But I know our board, our council is asking, so what does the health board think? So you guys are now saying, if you're not careful, well, what are your, we're not gonna, so I'd like to say that we have a conversation, and what we just did, but we can say, hey, this is what we're comfortable with, send that out, and make sure we keep that authority that we do hold. Does that make, I don't know if that makes sense, I hope it does.
Vice Chair, and then District Board of Health.
Thank you, Chairman. I guess my one option, and I'm looking to Ms. Reed for maybe some possible direction, but as I quietly mentioned to the chairman, is there a way that Ramza could proceed with the operations as outlined in today's discussion, and the board come back and retroactively approve that? Or, I mean, I guess that's going to have to take some more digging into the franchise agreement in regards to board approvals, whether it goes to the jurisdictions and then back to this board, because for the chairman to call a special meeting without having the approval from the other jurisdictions first, it makes it challenging. But yet we're in a time crunch, and the response and the allowance needs to occur. So you find yourself in a box where you're challenged to do one or the other, and really, in the enforcement portion of that, does that, how does that invalidate that they're trying to respond to make a response? So I find myself in a unique spot that it's a necessary situation, but because of legalities and literature, we're providing ourselves an inability to provide public service. So I find myself challenged with that. Is there a remedy for, because I know at the county commission we've done retroactive agreements and retroactive amendments to certain things based upon emergency directives, and hence this was emergency directive and allowance for that outreach. Does that change the scope?
District Health Officer, really quick, he's just been, yes.
I guess from my understanding of the process is that the cities of Reno and Sparks and Washoe County and Truckee Meadows Fire, since that's a separate entity from those three, they need to be involved in the discussions of the changes to the franchise agreement, but it doesn't need to go before those bodies for the Board of Health to then take action with the input of everybody. But I think what might work versus having a special meeting in a couple of weeks, not knowing where things are, and those discussions that are going on right now, maybe to have an item during the June meeting for Mr. Dow to provide an update as to where they've gotten with those discussions, what at that point it's looking like the proposed language or approach might be as an action item for the board to be able to provide some feedback and direction as to whether they feel like it's appropriate and moving in the right direction, or the board feels that there's different angles that ought to be explored and investigated, et cetera. And I guess I would also look to perhaps Mr. Dow as to how quickly he thinks we're going to get to a point where for that discussion with the board.
District Health Officer, I believe we can come back with submitted proposed language by June. I don't think that'll be an issue.
Ms. Reed?
I'll do my best to try to address the issues that were raised and put it as bluntly as I can, while recognizing that there is a situation here. I am not aware of any authority that would allow Ramza, and certainly this is a question between Ramza and its legal counsel. I can't advise Ramza to act outside of the scope of the franchise agreement in the absence of overriding authorities such as the emergency directive that was enacted by the governor. So I am also not aware of anything in the franchise agreement that allows for retroactive approval and application of an amendment after those acts have already occurred. There is a risk there, and that risk is essentially one for Ramza to evaluate with its counsel depending on its needs, but I cannot guarantee that would be valid or that there would be an ability to do that because their authorities are so clearly defined by that franchise agreement. So it is not without risk. Unfortunately, there's not a lot of information beyond the actual agenda item that would have informed of this discussion and direction. But because it's not an action item, I certainly have concern about any sort of advice that I would offer that would be a walk away with a changed circumstance.
District Health Officer looking to push the button, or?
Yeah, unfortunately, I'm not seeing the button on mine right now. But I guess what I'd like to, I think what we're trying to do with this item with Ramza's presentation was to acknowledge that the different EMS responders, the fire agencies recognize that the position that Ramza is in with the Directive 11 going away, and that they would prefer to see Ramza continuing with their tiered response while these discussions are occurring, because the alternative of going back to full compliance with the franchise agreement with all ALS responses would leave calls without, potentially calls without ambulance service that could have been provided if they were using the tiered response system and intermediate level response. So I think this is really was to provide information that basically it's supported that it's better for Ramza to continue what they're doing now as these discussions occur for a potential amendment to come back before the board, so that the board had that understanding that this was the best path forward at this time.
Councilman Dare.
So two quick questions. So how long after the emergency's gone do these guys, you have to have things in place moving correctly? Secondly, what happens if you're not back inside the realm of attainment of things you've agreed to? What happens? Because I appreciate that we all have good ideas and we're like, hey, well, everyone thought it was a good idea, but legality-wise, protecting our entity, your entity, and all of it, good ideas mean absolutely nothing if we're out of compliance, I think. But could you answer those two? Like, how long do you actually have before what the governor, now he took this back, so everything's back in place? Is there any kind of window? I know you're asking for that window, but is there any automatic window that could be given?
Councilman Dare, I'm not an attorney. I would have to look at the deputy district attorney, but my thoughts relative to the franchise agreement, there is nothing that I can remember that there is a time window, if you will.
It just seems odd. The reason it seems odd that the governor has this thing, so we're functioning this way. All of a sudden, it's gone, and everyone's like, "Oh, now you're out of compliance and in trouble." None of that makes any sense. So what we're saying is, everything you're saying makes some sense, and we're not against it. But legality-wise, where does that leave you?
I wonder. So, according to the franchise, you're out of compliance. As of today, because the tiered system does not allow for you to do.
Because the tiered system's active.
So you're out of compliance on that. You're out of compliance in terms of response times too at the moment?
No.
You're not? Okay. No. I was misinformed. Being that you're out of compliance, District Health Officer, maybe it serves us to get a memo of sorts in terms of if REMS is out of compliance, how much time do we have to allow for them to get into compliance before actions need to take place? Hopefully within that time frame, they are able to have those discussions and then be in compliance. I probably need some legal from Ms. Reed or what that franchise allows us to do that, but I think it's a recognition that the legalese is that they're out of compliance. We see that, but there's work being done, but that everyone's covering themselves in terms of how things move forward. And if things need to, we'll call for a special meeting. I'm open to that. I want to make sure we're above board on all these pieces to make sure you guys are successful. We want to make sure everyone's compliant and we get the best response. And we can't take any action today, but my hope is everyone's reading between the lines. We need to get this resolved pretty quick. Any further discussions? Any public comment?
No public comment.
Thank you. We'll close item C. Mr. Dow, we'll move on to item D as a discussion for approval for a rate increase. Mr. Barry Duplantis.
Well, thank you. Dean,
We're gonna, if we
You
can.
tag team it, all right.
We'll both sort of interface on this presentation. Again, to the board, I'm Dean Dow, President and CEO of Rimsa Health and CareFlight. Let's see. So, first off, we do appreciate the time and effort and energy that all of you have put in with us collectively over several months, discussing and looking at healthcare in this community, looking at pre-hospital care, how it's structured, how it's reimbursed, et cetera. Not only here, within Washoe Valley, but also across the United States. So, with that, our executive summary is Rimsa Health is requesting an increase in the maximum average patient bill. This is the first time that we've had a request for a major increase in approximately 5 years. Due to the dramatically increasing cost in our nation right now, also as we are facing, and healthcare in general is facing, a stagnant reimbursement situation across the country and has for the last several years. Rimsa Health is requesting an increase that would allow us to collect a net increase of $62 for each transport that is paid for. In order to achieve that $62, giving the commercial insurance situation in the state of Nevada, we are requesting an increase not to exceed $1,950. The gross average bill required to collect an additional $62 per transport only applies to, as we term it, non-governmental payers. So that would be commercial payers, for example, Blue Cross, Blue Shield, Aetna, et cetera. This would not apply to Medicaid and Medicare, as we all know those are governmental payers. Non-governmental payers, when you look at our payer mix, comprise approximately 27% of the ground transport payer mix. In our calendar year of 2022, our CPI increase was only 0.2794%, which equated to an increase of $4.25 per transport. However, as everyone is aware, inflationary pressures are across the country, and we are no different. And our expenditures are projected to go up over $4 million, roughly 12% versus the prior fiscal year. Rimsa Health has been challenged by the national healthcare labor shortage, as many organizations across the country have, many healthcare systems across the country have. Also, this year, we faced a $500,000 increase in our annual healthcare coverage premiums for our employees, which was not passed along to the employees. As we all have seen, a meteoric rise in fuel cost. Mr. Duplantis will touch on that in a minute. So fuel in and of itself right now is running a little over, will be running a little bit over $1 million this year. And then last but not least is all of healthcare, and I think really all organizations and businesses across the country. But we've seen a massive increase in the cost of medical supplies. Rimsa Health, just a review again relative to the employees. Earlier this year, we adjusted our shift schedules and went from sort of our historic 48 hours per week down to a 40-hour work week for our field personnel with no reduction in their annual pay. This effectively raised wages by 30% to the organization at an additional cost of $2,800,000 per year. We also, last summer, so almost a year ago, July 17th, increased compensation across the board for our employees of our organization of 3.5%, which led to an additional $500,000 increase in total. So, as you know, we are recognized as a nationally high-performing mobile health care provider. We respond to over 80,000 calls per year, and we transport a little over 50,000 patients per year. As you're aware, unfortunately, we are fee-for-service, as most pre-hospital care organizations are across the country, meaning that if we don't transport somebody, there's no charge structure. So if we look at the number of calls we respond to, the number of patients that we transport, it's approximately 30,000 unreimbursed responses that we incur in a 12-month period. Our cost to respond to a call is $380 on average. So there's approximately $11,400,000 cost just encapsulated in the 30,000 responses that we do not transport for various different reasons. Rimsa Health, as you're aware, cares for all patients regardless of their ability to pay or the number of times that they utilize the service over a calendar year. In 2021, Rimsa Health provided $3.2 million in uncompensated care and charitable care to the citizens of Washoe County for ground ambulance service. In 2021, our investment in capital to the organization was approximately $2.3 million, and that was to upgrade our ambulances, our stretcher systems, radios, cardiac monitors, and we've done all that, as you well know, without a local tax subsidy. And then we'll just close that, go back to the market study that we presented to you a few months ago that Fitch and Associates did, indicating the work that the organization does and sort of how it was placed on a national basis. So I'll turn it over to Barry. Thank you.
Barry Duplantis for the record. Rimsa Health is a nonprofit community organization. And as a not-for-profit community organization, we're governed by a 7-member volunteer board of directors. As Dean mentioned, we're funded exclusively by user fees, which means that when we transport, we have an obligation and an opportunity to invoice for that transportation. For the 30,000 times that we respond, provide care ranging from minor things to even major things with just simply without transport, there's no bill incurred to the patient. Having said that, we are clearly a labor-intensive organization. Much of, in fact, substantially all of the work that we do in the community is done with caring people, providing services. So 70% of the dollars that we spend to run our organization is spent on labor. As Dean mentioned, CPI in the last year, which is how we get our adjustments currently, is based on CPI change from year to year, and that change from 2021 to 2022 was very modest. So the amount of increase that we received was truly $4.25 per transport. Inflation, as you know, since the fall of 2021 has been far greater. The CPI index for the month of March was 8.5%, and then for April, it was 8.3%. And as Dean mentioned, our expenses are rising in all categories, and that's one of the reasons we're here today. But let me also say that what's actually, to the core of what we're talking about is that we're talking about highly specialized, highly skilled caretakers for which the pool is really shrinking. Nationwide and even locally, we find that there are fewer people in this profession that are available to be hired. And for those that we do have, I think we would all admit that we want the highest quality of skill and professionals tending to the members of our community. That said, we continue to do everything that we can to compensate our employees to the best of our ability. But as you know, turnover in the healthcare, as well as turnover in our business itself, has been quite significant. Healthcare, or I should say, particularly with EMS nationwide, has had a turnover of about 25 to 35% per year. At Ramza, we have seen turnover at about 44% per year. And the primary reason is when we bring in people, oftentimes they will move on to other opportunities, sometimes out of healthcare altogether, and sometimes because the cost of living here is expensive, they'll go back where it came from because they will acknowledge that it's just too expensive to be here. So the solution to that is really we need to continue to focus on compensation for our workers. And we've done a multitude of things. We've done sign-on bonuses, we've done housing assistance, we've done time-off incentives to help people get situated. We've done referral bonuses. And as Dean mentioned, we reduced our work week, which was really a 48-hour work week. We've reduced it down to 4/10s to make it a 40-hour work week. And we did that without adjusting the annual salary of individuals. So if you translate that, it means that our caretakers receive a 30% increase in their wages. And just for reference, as you might wonder, a typical wage for a paramedic is about $70,000. I mean, so we're not talking about, high incomes here. So if I give somebody a 3.5% increase in their wage, that would bring them to about $73,000. So, I mean, when you look at the compensation of medics, I just want to keep that in perspective because it's important that we know that. The other thing that we also have, which is very stressful in this industry, is in our company in particular, we try to focus on the mental health, physical health, and psychological well-being of our employees. Because let's face it, nobody calls 911 because they're having a great day. They need our help. And so that being said, it takes a lot of strength in character for our employees to continue to be their very best. Having said that, as Dean mentioned, we've seen rises. I mean, as the Chief Financial Officer of the company, I can attest to rises that we've seen, not only in labor, which we know we've needed to address, but fuel has been the other big kicker for us. As you know, fuel's now running around $5.50 per gallon. As Dean mentioned, we generally burn about 20,000 gallons of fuel in a month. And our most recent gas bill was $95,000, and that was reflecting on the month of March. And we know that gas prices have gone up even since. The other thing that is very notable is that since COVID, and I don't know that COVID was a driver of it, but certainly I can say it's post-COVID, we've seen rises in our medical expenses. We use more of it because we use PPE in order to protect workers, but we also do a deeper cleaning and sanitation. So as a result of that, the costs of our business have risen. So when you start looking at, so I'm here asking you to approve a rate increase taking us from the current $1,526.17 up to $1,950. What will I do with that money? Well, I'll candidly tell you, as you see on the screen, I want to continue to focus on improving the wages of our employees. They are the precious component of our business, and they care for the members of our community. I'd like to continue to focus on modernization of our technologies and our infrastructure of patient care. And let me say that as a community-based organization, and Dean said it first, we care for everyone regardless of their ability to pay. Now, I will also say that as I stand here in front of you, I don't want to just come here and simply ask you for your support on the money side. We have certainly done a number of things internally to reduce costs, because continuous improvement is what we must do on a daily basis, because it's not just always doing things the way that they've always been done. That said, I'd just like to point out just a small sample of things that we've done over the last few years. In 2019, we did an early retirement with some folks. We called it a voluntary retirement incentive, where we had folks that were not particularly involved in patient care, and we gave them an opportunity to retire early. Several of these folks did take advantage of that, and that saved us a fair amount of money on the administrative side. Over the last few years, we have also been working hard to replace aged and worn-out ambulances, and you'll now see around town where you'll see the Type 2 ambulances, which are the transit-style vehicles that you'll see rolling around town. Those generally get substantially better gas mileage. Putting it in perspective, the Type 3s, the big truck styles, generally get like, it's about $1 per mile to operate. The Type 2 ambulances, the smaller ones, are running us around 30 to 50 cents per mile to operate. So we're constantly trying to become more efficient. Another thing we've done is we went to our bank in the middle of last year, and we renegotiated our loan. We don't have a lot of debt. We just owe about $1.2 million at this point. But nevertheless, because we've got awesome credit in the way that, as our financial records show, we went to the bank and we said, because we are good stewards of our finances, we would like your help to reduce our loan, and they did. So we now have a 3% interest rate for the balance of that loan, which goes out to 2028. And then on the CareFlight side, as you know, we contract out, or maybe you don't know, and I'll tell you now, for the pilots that operate the aircraft. We contract that out because they're professionals in flying aircraft and maintaining aircraft, et cetera. Our agreement previously required a CPI adjustment of 3.5% or above, and thankfully we put this in place in the fall of last year, and we capped it at 3.25. So I'm really grateful we had the insight, or I should say maybe just the intuition to do that when we did, because you know that CPI now is in the 8% range. So I'm happy we did that when we did. And then more recently, in the month of April, we had a rotor helicopter that we were not actively using. We carried it as a spare, and we sold it. So anytime there's an idle asset around our campus, you can pretty much rest assured it's going to have a for sale sign on it pretty darn fast, because if we're not using something, we generally will turn it to cash. So that said, our request, as I just said a moment ago, is asking you to increase our average bill from the current rate of $1,526 to $1,950. That's going to provide us with an additional ability to collect, as Dean said, about $62 per transport. So it'll take us from my current collection per transport at about $454 up to $516. The folks who are affected by that, as you can see on this particular slide that I've added to the deck for you, you can see when you look at, what's the impact of this increase. 70%, the Medicare, Medicaid patients will not see any increase whatsoever. Neither will Rimsa. Rimsa will only get what Medicare will continue to pay, which is about $380 per transport on average. Medicaid is going to continue to pay on average about $260 per transport. So that 70% of our patient population will be unaffected, unimpacted by the rate increase that I'm asking you to consider today. So the folks that are affected are the people that have commercial insurance, which is like the it's like the Cignas, the Blue Cross, Blue Shields, Aetna, that kind of thing. Those are the folks who are most impacted. So I'm asking you to approve an increase in our average bill of $423.83. Of that, as you can see there, the current copay, what the rate is as it is now, with the 1526, the current copay for the average citizen is $391.80. They will experience an increase to the tune of their copay under the rate increase. And let me say with commercial copays, they generally are about 25%. So, I mean, that's just the way the math works out. So my commercial insurance covered patients will see a small increase. Uninsured patients, same story that we have now. We have a tremendous amount of compassionate care, charitable care that we provide to citizens. And on average, I mean, the reality is that on average, on my uninsured folks, I generally collect about $38.15. I mean, so that gives you a sense for where we are on our charitable care. And I'd also like to just add a note to that. The first document that Dean presented to you today was our franchise compliance report, which includes a questionnaire that's sent out to patients that we care for. And consistently, we score really well with patients commenting on how they're treated by our business office with regard to collections and requests for money. We score very, very high in the way that we treat people. So having said that, I'd really like your support. I clearly could use this increase to take care of my workers, to address some of the rising operational costs that are out there. I think the way we've also structured the request in the staff report, which you also have, is that I think we've agreed that we would revisit our situation in December. So that said, I am available to answer any questions you may have. Chairman Delgado?
Thank you, Barry, for that presentation. I'm looking to the board for questions regarding the rate increase. Let's see, view speakers, no speakers, looking down. Dr. Clacking? Yeah, there you go. Awesome.
On here or not? There it goes. So a couple of questions. You said right now you're collecting about 30%, correct?
Correct.
From the public. You and I talked about this a couple times yesterday, and
Is Mike on?
that's the average you're saying nationally. I'm sorry. That's the average nationally or median in that area?
Correct. That is correct.
What are the top people collecting? What would a top county be collecting, do you think?
Well, let me say the thing that really impacts our collections is that when a call comes in and someone is requesting 911 service, they are expecting service right away, which we certainly provide. That said, we don't collect a copay up front. So as I look and compare ourselves to even other businesses in healthcare, because as I indicated, the 30% that we here at Ramza collect is consistent with what other EMS agencies collect nationwide. When you stop and look at one attribute that 911 has in particular is that we don't collect copays when people are calling in for a 911 service. That said, trying to collect copays after the fact is incredibly hard. Very, very hard. But we're required to do it. Even with Medicare, Medicare legally expects us to collect copays because they consider it an obligation of the Medicare patient, and they consider it an obligation of the Medicare service provider to pursue collection of those. But the actual result of what we collect is minimal.
Yeah, I understand that and what you're expressing, but if I looked across other counties in the nation, much like your report previously was comparing you to other cities, the top of that list if the average is 30 or the median is 30, somebody's probably collecting 40 or 50 across some cities, correct?
Correct, but I don't have data to share with you that would answer that question.
Do you have any idea what they're doing different, or is it just their population base?
I would suggest that it's population-based, and I'll share with you an additional component. In our benchmarking studies, as I started looking at how other communities actually handle EMS billing, I reached out to a couple of, to many different places, but there are two in Oregon that I spoke with specifically, and they have actually a charge for response. And I said, so how does that work out for you? And they said, truth of the matter is, it's only in certain conditions where we actually do send the bill, and our success of collecting charges for response with no transport is minimal.
My second question is, what's the potential for further technology improvements to increase efficiencies that lower cost and can advance service too? Where can you go next in the future with this?
Well, there are a couple things that we can do, and Dean elaborated in the topic item prior to this one a bit about that with the assess and refer. There are a couple things that we actually do here in Northern Nevada at Rimsa. We do have a nurse health line that was established in about 2012, 2013 timeframe. And so in terms of reducing costs further, one of the things that we as a community need to be acclimated towards doing is better patient navigation, so that we're only rolling wheels on high priority, high acuity calls where people really need an ambulance. Our nurse health line is offered to patients where when the 911 call comes in, we identify that the acuity is not quite as high and they could be treated with alternate paths. So the reality is right now the 911 feature provides people with access to healthcare, and let me say maybe easy access to healthcare, because it's almost like the easy button, if you will, where all people can dial it and they know that they will get a response. But the reality is, in terms of controlling costs and where do we go next, we need to continue to focus on navigating patients to the right levels of care, because in most cases, they truly don't need an ambulance to an emergency room.
Yeah, I'll just comment. I can't agree more on that. And there's been a lot of work lately on people trying to drive us in that direction, and I hope it gets done.
Thank you.
Thank you. Additional comments from the board? Councilman Dare?
Yes.
And then Vice Chair after, sorry.
I appreciate, we've been having this conversation actually for quite some time, and I appreciate having it here. I'm comfortable with the number and ask, and I want to say why. Part of it, and I want to make sure it's read because you didn't totally mention it, but I do want to mention it because I think it's important here. Is there's a commitment to make sure that no longer than one calendar year from the approval of this request, Rimsa will neither change nor enter into any new agreements with any regional partners for ambulance or dispatch services without first presenting them to this board for input and approval. I know you wrote it, so you agreed to it.
Yes, sir.
I like saying it out loud because I agree with that very much so. Now, part of it is I just want to say at large, this is, obviously you have a particular job is to make sure you take care of those who work for you, and I appreciate that. I have a particular care to take care of the people who live in this particular region and make sure that they have what is needed. I do believe that you guys are that people to help do that. But I got to tell you, and I'm going to say it aloud, and I told you I'd push on this. I'm okay to do this now, but I want to continue to push us for dispatch. I want to make sure that we are doing everything we can to make sure we're communicating. I do think that will save us money. I do think that we'll have the best care for our people, and it will cost them less when we do this right. But we're all in this conversation, and we all need to be a part of it. I know you have been, but I just want to put it on record again. Probably every time you're here until we get to that place, I will say these same things. But we can't keep going down and putting Band-Aids on things. This is not a Band-Aid. This is understanding where we're at as a community. But for me, if we are here in December and we have no movement on these other things, then we need to look at a whole other aspect of what's happening, for me.
Thank you very much, Councilman Dare. And also, too, I might add that I didn't read out aloud the whole recommendation that we've that drafted in and sincerely mean all the words that I put together there. I mean, wouldn't have presented them to you otherwise. So it's rather lengthy, so that's why I didn't read it all. But rest assured that all of the words in that staff recommendation that we're putting forth before you are sincere and genuine.
Vice Chair Lucy. Thank you, Councilman.
Thank you, Chairman. I do appreciate the opportunity to chime in on this. This is something that's very important to me, and spent quite a bit of time researching and spending time with. And I understand the passion that is coming from Councilman Dare's discussion about not entering into agreements in regards to regional partners about ambulance or dispatch services without presenting them to the District Board of Health. But I fail to see how that's germane to the issue of what the request is. But I'll go along with it just because I think this is important in the sense that regionalization and discussion is different than having an ability to bill and sustain your business. They're two different things. All of us are very fortunate, at least the electeds that represent the region and participate in this discussion, that we are able to subsidize and utilize our budget through grant funding, taxes, or a number of different things to continue to provide services to our community. Washoe County being the largest of these regions at a $1 billion budget, balanced $1 billion budget to make sure that 24 different departments, this one being included, is completely funded to provide public health. But to continue to tell Ramza that they can no longer pursue discussions with other entities, whether inside, because it doesn't say specifically whether inside or outside of Washoe County, is limiting to them in their business fashion. So I disagree that should be germane to this discussion. Secondly, what I would say from a standpoint of insurance, this discussion has gone on in regards to we should not or move forward in support of a $1,000 increase to their bill because of, and there are two motions in here that I've read through the staff report, because it would be too daunting for the general public to take on. Yet we sit here and say that their pay for staff is not enough, and we have not been able to adequately give them the ability to do so. And when you talk about a nonprofit organization that is governed wholly by the District Board of Health, and yet they are not subsidized by us, they are completely self-sufficient and have to rely heavily on commercial and federal reimbursement. And, you know, I'd like to point out on the franchise agreement, Washoe County as a whole plays our hospital providers indigent coverage for indigent people. Mr. Duplantis, Mr. Dow, can somebody tell me how often do you respond to indigent services within Washoe County?
Dean, would you like to take that question?
Dean Dow for the record. County Commissioner, we could come back in June and give you a specific number, but I will tell you that in our payer mix, roughly 40% of our payer mix is Medicare, roughly 30% is Medicaid. Again, as Mr. Duplantis pointed out, I think approximately 27% is commercial. So the balance is folks that have no means. Again, as we presented in the slide deck, roughly about $3.8 million in the last 12 months is what we budget, if you will, or present to our board as uncompensated care. So that's really individuals that have no means, or it's individuals that have a balance and they don't pay it. So it is a significant concern to the organization.
Okay, thank you, Mr. Dow. I appreciate the clarification. Because as I was pointing out, our hospitals are allowed to bill Washoe County for any indigent services provided at our hospitals. However, through the franchise agreement that was drafted, it is not allowed by Ramza to bill the county for indigent services for those individuals that you provide unrecovered service to, correct? You cannot bill the county for indigent services for those individuals who are not represented in Medicare, Medicaid, or commercial, correct?
That is correct.
All right, thank you. And so when you look at this and you know that, and all of us go to the hospital, we have insurance, we participate in insurance, we have employers or we self-pay our insurance. We know that when we go to our doctor's office, our doctor's billing our insurance bill for, let's say $1,000. However, the recovery from a commercial insurance broker or provider is roughly probably anywhere from 30 to 40% once they've discounted and agreed upon price. And I have a feeling that the same thing happens with Ramza when they submit to a commercial provider in regards to their recovery of that fee, whether inflation goes up, whether gas goes up, whether cost CPI goes up, they're still going to predicate what they're going to pay you for any given service, correct?
Correct.
So the abilities to do that, so if you're able to bill at a higher rate, you may be able to recover a little bit more, but not necessarily the entire amount, correct?
Absolutely correct.
Okay. And then to Mr. Duplantis' point is when we walk into a hospital or into a doctor's office, we have to pay that copay up front before we even see a facility or a doctor or a practitioner or any of that nature. You, on the other hand, are required by the agreement to move forward and provide a service and give that service to that individual and then try to collect that copay on the back. And from my understanding, Mr. Duplantis, what you told me is you said your copay collection is around 19%, is that correct? Or what was the number you gave?
Yes, let me review that for you just to be clear for the record. Of the, generally with private insurance, the copay averages out to be about 25%.
Okay.
I'm able to collect about 18% of that 25%.
So you're able to collect about 18%, and then overall, your total billables in the last fiscal year, what's a representative number of copay? Would it be like 7% of the copay cost? So we'll say it's $3 million. Were you able to collect 7% of that?
That's about correct.
So about 7%?
It's actually 4.5%.
4.5% total.
4.5%.
The actual billable copays that you sent out, whether they were commercial, Medicaid, doesn't matter.
That's correct. It's about 4.5%.
Okay. So so from my standpoint, and this is just one voice, it doesn't make a whole lot of sense that we keep asking for more from an organization that is wholly restricted by this entity without giving them the ability to work hard to bill an insurance company. It's not going to cost us. It's not going to, and as you pointed out, 4% are only paying their copay and the rest of it are writing it off. Why are we restricting the ability for an agency to bill and try to collect in an environment like this post-pandemic without giving them the ability to be successful? Now, I don't disagree that we need to move forward and continue to move forward with regionalization and talk about how we can more effectively provide better service within our community. But I don't think limiting these individuals so that they can pay staff, they can fill the tanks, they can have adequate assets that are on the road, providing ground transport within our region without that money. So those are my comments. I'm supportive of either option that the board has presented in the staff reports. But I feel very heavily about making sure that an agency that we require that provides services to all of our citizens within Washoe County, not just one, but all, the ability to collect on their services that they provided. Thank you, Chairman.
Thank you for your comments. Chief Brown.
It's on? Okay, good. I appreciate the numbers, appreciate the discussions we've had over the last few weeks on this issue. And one thing I just want to point out is that, RIMS is not the only one who's looking at trying to adjust rates. Anybody in the industry is looking at rate adjustments because of what's currently taking place. And you look out in Nevada, I looked at several organizations that do ambulance billing, and, I felt very comfortable when we discussed rate increase of the amount that you're requesting to keep it under that $2,000 range, because that's about the average throughout the entire state. Clark County just approved their rates for their providers down there at $1,800. You look at most of the fire jurisdictions up here in this area, they're close to that rate schedule as well, and they're all looking at increases for their rates as well because of what's taking place. And so, I got to say thank you, for looking at those and, coming up with the numbers that were actually easier on the entire industry and more conformance with what everybody else is trying to do in the area as well. So, I think that was good to look at. A lot of discussions. One thing I got to keep reminding myself is that as a board, we're here to look out for the ambulance franchise, the transport side of the franchise. Okay, we have nothing to do with the other industries that Rimsa has taken on. So on the franchise side of things, that's what we need to take a look at. And, I'm not going to say, how you should be taking care of your business, what you should be doing, what you shouldn't be doing. But the ambulance franchise was set up for ambulance transport. They've chosen to take on other commitments with other programs, and that's their choice to do. I just wanted to make sure that as a group, we look at the ambulance transport side of things. And when it comes to everything else on the add-ons, that's their responsibility to take care of that in any financial way they can responsibly. But when it comes to what we're doing here, it's the ground ambulance transport side of things. And that's how the franchise was initially set up, is that Ramza would be the oversight for the franchise to ensure that services were being provided at a cost-effective rate. And one of the big reasons they brought the franchise into existence was to keep ambulance transports down, to keep those rates to where it was affordable in the industry. But as I know Mr. Dow is probably tired of hearing me saying, that was 30 plus years ago, and things have changed. And so,
I'm tired of hearing you.
and so that's why, I got to agree, we start looking at things on a regional aspect because there's been a lot of changes when it comes to the franchise. And there's been a lot of amendments to the franchise over the years as well, So again, the ambulance transport side of things is where we really need to narrow down to and take a look at. So I appreciate working with you and appreciate seeing the numbers.
Thank you, Chief Brown. Dr. Novak.
Yeah, I really want to tell you how much I appreciate the work that Ramza and especially Barry has put in discussions that we've all had on the side, trying to understand what's going on. I totally support the idea that we've got to get you more money, just like everybody else is going through expenses right now. So I do appreciate that. I support the motion, and I'll go ahead and make the motion that we accept this and move forward, if that's okay.
I'd like to make a comment as well, too, please, if that's okay.
Absolutely. Well, Dr. Novak, we'll go to you once we're done with comments.
Okay.
Dr. Danko, then we'll go to
Yes, thank you so much. Can you guys hear me okay?
Yes, we can.
Great. I'd like to, first of all, support and say I could not agree more and more wholeheartedly with Commissioner Lucy. And thank you for your comments. I think they are spot on in a post-pandemic era, and they are even spot on in a pre-pandemic era. I think that we have yet to point out the extent of burnout in healthcare. I am one of those providers on the front line and have been for years. And burnout is exhausting and it is extreme. And I'd also like to point out the extreme difficulty, if not impossibility, to find staff at all levels to work in healthcare because of the burnout. So I would like to say that in pre-hospital care and in hospital care and in post-hospital care, where you are transporting patients from their home, from the side of the street, or from a hospital or a nursing facility, or back to a nursing facility. Thank you to Ramza. I think we have failed to say that today. Thank you to Ramza for doing your part to save lives and help lives every single day. I think we have said it, and Commissioner Lucy has very nicely highlighted, costs have gone up, healthcare costs have gone up extraordinarily. We do have more requirements of PPE. We are having different constraints with respect to COVID and post-COVID. Patients are sicker. Acuity is different in the hospital, and acuity is different outside of the hospital and after the hospital. And that also drives up cost of healthcare. And I'd also like to say thank you for changing and molding as healthcare does all the time. We are not operating in a silo, and I disagree that an ambulance service is a service to transport somebody, regardless of the call, regardless of the acuity. I think that it is an individualized approach to what is happening. It is a triage, which brings in the points of the right level of care for the right person at the right time. If we don't do that, healthcare in America will fail. What we have to do is make nursing hotlines. We have to treat people at the level of care with the problem experienced by that person at that time. If we merely transport everybody to the hospital, hospitals will fail. If we fail to transport the right person, healthcare will fail. So thank you for changing, because as I've said during COVID and making other comments, healthcare changes based on data. It changes based on science. Even our treatment of COVID has gone 180 from where we started in 2020 in certain regards with certain medications. There are still preventative aspects that hold true, but certain parts of it have changed completely. And with that changes pre-hospital and post-hospital care offered by Ramza. So thank you, Commissioner Lucy, for highlighting those things. I think the rate increase is not only necessary, but I wholeheartedly say, hey, would I like gas to be cheaper in my car? Sure, I would. But do we have that choice? No. Inflation is a real thing, and healthcare costs have gone up extraordinarily in a very, very difficult time. And I actually apologize that I sit on a board that has made this more difficult for you to continue to care for people on the front line. So with that, I say I support Ramza. I support anybody out there working in healthcare, because the burnout is here. The impossibility to move forward without making adjustments is here. And I beg of my fellow board members to please do the right thing to help care for patients who are sick. Thank you.
Thank you, Dr. Danko. I'll jump in really quick. As you part of your payer mix, you said the people that are going to be impacted. Just for clarity, you said that no one in Medicare, no one that has Medicare, no one that has Medicaid will be impacted. Is that correct, Barry?
That is correct. All of the government reimbursement is based on government determinants. I have no impact on those rules.
And if a senior that has Medicare does not have Part B, will they be charged this amount?
If a patient does not have Part B, they will be subject to the standard average bill that you're asking, that we're discussing right now.
So if you do have Medicare, but not Part B, you will have this increase. Is that correct?
That is correct.
Okay, just for clarity. So people that do have Medicare, for the community that's listening, if you don't have Part B, you'll have this increase.
Correct. Now, let me just add
You're
one
talking
thing.
about only fee-for-service Medicare, because many patients that actually have Medicare have Advantage plans with Medicare, which is actually a commercial payer that essentially takes over your Medicare payments. In that case, it would actually follow those commercial contracts. So please, without saying whether you have Medicare, many patients have Medicare PPOs that are actually commercially run. So that's not a generalizable statement to say if you have Medicare, you will see that rate increase. That is not correct.
Dr. Danko is correct.
Thank you, Dr. Danko. Just for public meeting, want to make sure we have the right information. What you presented to me on the slide was that all those that have Medicare will not have an increase.
Correct, with the distinguishing factor being that those folks that have the Medicare Plus and Medicare Advantage are treated as insured as opposed to government payers.
And for clarity, again, to what Chief Brown stated, according to our franchise agreement with you, unless amended, or what comes back to us for amendment or adjustments, our current contract with Ramza is ground transport. Is it the nurse hotline?
No.
Is it care flight?
No.
Is it the training, community trainings that you guys provide for our community members?
No.
Okay. Is the nurse hotline currently in the black or in the red?
It's in the red.
Or do you have the programs in the black or in the red?
They're in the black.
They're in the black. Okay. These questions that I'm asking, I believe our board are asking, not with reference to poke at Ramza, to not appreciate the amount of work that Ramza has done, right, and continues to do. And in many different ways, I've had some really great conversations with your board, Mr. Dow, that they were very pleasant and very pleased and respected the work they were doing, but they also appreciated these questions that we're asking of you, because they understand that we're asking from the perspective of the community, right? We want to make sure you're solvent, that you're able to continue with the work that you all do. As I expressed to you several months back, I was caught off guard when we were presented at every month that Ramza was doing well fiscally, when Ramza was moving forward during the pandemic in many different ways, and then it was brought to our attention that things are quite different. And I believe that's what caught many of us on the board off guard, because that information wasn't presented in front of us in an adequate time frame. And so now we've got to react just like the previous item. Now we've got to react, correct? And so we're just trying to make sure that we're stable, we have our feet under us, and we're doing our due diligence to ask questions of those of our safety net in our community. Without poking, we're just doing our job as elected officials to go back to our constituents and say, we've asked the tough questions, okay? I've had plain conversations with all of you and said that, to Vice Chair Lucy's perspective, is things are going to continue to change. To what Dr. Danko is saying, is that there's something broken with your independent business model at the moment that we need to fix. And if we're not asking the questions of you in terms of what those fixes look like, then we've got to make sure we're asking the questions to make sure there is that strong safety net moving forward. And Barry, correct me if I'm wrong, Mr. Dow, you've told me that the same. Do you agree or not agree that the current business model that you have in front of you is broken?
Chairman, we agree, and that's, let me note, that's why we started these conversations back in October of last year. Also, let me note, reference to CareFlight, the melding, if you will, of CareFlight and Rimsa, I think happened before all of our times. And that was, in my understanding, again, that happened in, Chief, remind me, 1985, 86 timeframe. And that was a decision driven by the governmental entities at that point in time. Yeah. It wasn't necessarily a decision that Rimsa decided to go out and take over or acquire CareFlight. That was a decision made by the governmental entities and the two hospitals at the time that operated CareFlight to merge, if you will, the two systems together.
And so, again, what you're hearing from me are not questions in terms of my belief and the great men and women that work for Rimsa. It's a reflection for the community, making sure that there's a long, sustainable outcome that we see you guys supported moving forward. It's just the information that's been presented to us up to this point, and then we've got to do our due diligence to ask the questions. Okay, it's nothing to outside of that, and I believe your board members feel the same way. And so again, going back to is, and to what you had just stated right now, there's some fixes that need to happen. Fiscally, I believe many of us on our boards here, that we all represent our counties and our commissions and our cities, because we're all pretty fiscally conservative. We don't want to waste any taxpayers' money or anything else. We don't. And you had just shared with us just now that there's something wrong. And so I believe it's the due diligence of our body to say, come back to us in 6 months with some corrections of what do we need to do to continue to move forward, that we're not spending money inappropriately. I don't see anything wrong with that. I believe we believe in all of you to come back, and Barry, we worked with you with the amount that you guys allocated for $420, 423, et cetera, I don't know the exact number. If you guys would have come forward with $1,000 ask before, that would have put us totally out of whack in terms of the regional response rates that currently exist on the West Coast. Chief Brown, correct me if I'm wrong. And so again, we need to make sure we hold our ground. We have these conversations. They're uncomfortable, but do not take these uncomfortable conversations as being a direct hit towards you or your organization. It's our jobs to make sure that we're long sustaining, and we want to continue to support you.
Yes.
Councilman Dare.
Yes, and I only want to say one more thing, because a few things were said publicly, which when things said publicly that I don't think are correct, I need to fix them. First of all, I don't believe our board has been against you and making it difficult for you, and I apologize that someone does think that. But I can tell you that we do have a role to play, and we are excited to work with you and figure out what the next steps are. I think you know that, but people are listening publicly, and I want to make sure they know that that is where we stand. And it does not mean we won't ask the difficult questions, because we got to. That's part of what we were placed here for. The other thing that's important to be said, when I talk about not going around to other groups or whatever, I understand the sacrifices and different things every entity makes, but it's just part of the franchise agreement that you would do that. It's not something I'm asking. It's not outside of franchise agreement. It's actually part of it. So it should be what they would do anyway. So with that said, I'm just asking us to stick to the franchise agreement, not to come up with something separate.
That's understood.
Thank you. I just want it publicly said because there was something else said. Thank you.
I don't think anyone's opposed to working and supporting Ramza. Vice Chair Lucy.
Thank you, Chairman. I want to go back to a couple comments that the other board members had mentioned, and like I said, I still adamantly oppose the idea of combining issues of regional partners and ambulance with agreements and whatnot into an issue that is not germane to rate increases. I think it doesn't play to this at all. I think the franchise agreement, as pointed out here today, is 30 years old, as Member Brown pointed out, that it has some significant challenges to it, changes that need to be made. One of most, the indigent care, the ability to bill for indigent care to the county, as that is the responsibility of the county to pay for that. I don't think that you should be held hostage by an agreement, not allowed to do that. And I don't think putting more restrictions and covenants into an agreement or a franchise agreement is conducive to a real. I don't think it's right. And I think Dr. Tanko is exactly right in the sense that the paramedics of Rimsa for Grand Transport are the first line of healthcare for us. They're the ones that address all of the needs and the concerns within our community when emergencies arrive. However, I would also say the services that Ramza has brought forth, as the chairman pointed out, that are additional, not within the franchise agreement, are of a benefit to our community. The nurse helpline helps make sure that Ramza and our fire agencies and our abilities to keep service calls low is a service. I think CareFlight, to allow for the immense area in which we have to have ground transport in, provides adequate, better response time for those individuals facing life-threatening injuries. I think that what Ramza has done to augment their business model, whether it broke it or not, and I think to the chairman's point, he is right. And you were right, Mr. Dow, that ground service transport around this country is broken. It's a broken model and it needs massive repair, and you see that across this country. However, to limit your ability to do further things with your business through a franchise agreement that we've already stated on this record, this board is in agreement with, that is old, antiquated, and broken, is in my opinion, ridiculous. And the law is not, this is not law. This is a franchise agreement. It's excuse me, I can make my comments, and I think I'm within my rights, sir. I just think that what we are doing here is limiting in the sense that this is not law. It's not NRS. This is not law. It's not law. It's an agreement. It's not law. So it's an agreement between two parties, this party and that party. If we can't come to an agreement, this board and that entity, then it's an agreement. So my point is that talk about the franchise, talk about the pay increase, and deal with it. And to Mr. Brown's point, the discussion about Clark County and having it be in conformance with the area, I would contend that Clark County is also 5 times, 10 times the size of us, quite sizably a larger budget, and has the capability of doing better service when we have a larger area to cover. So there are differences. We cannot use generalized statements when making these arguments. And I as an individual, and I'm one board member, but I feel that this is not productive, and it's not germane to the discussion. So once again, just questions and my comments. Thank you, Chairman.
Appreciate the comments. Sounds like we're getting to a motion here. Do we have, yes, Ms. Reed?
When a motion is made, I'm going to request that the motion be made and read specifically. There is an error in the staff report. The version I have, which I am going to take a leap of faith and believe it's the same one that you all have based on Commissioner Lucy's comments, There are two motions there. One of those motions was not supposed to be in the staff report. The amount that you can approve should not exceed the amount that is actually listed on the agenda, which is I think it's the 1,526.17. That alternate motion was an original draft that had then been revised, and that contains an amount of $2,500. Because that amount wasn't agendized, the public would have no idea that that rate increase might actually be bigger than what they were notified. So I just want to bring everybody's attention to the amount discrepancy. If you also have the same version that I do with the two possible motions.
And I'd ask that Dr. Novak had stated that he's ready to make a motion. If you would, Ms. Reed, kindly hand him that language to be able to read word for word so nothing gets lost. Susie, do we have any public comment on this item?
No public comment, Chair.
You're right. You're right. And thank you to Vice Chair. He had kindly reminded us that there is no 6-month review on here, so if that could be added.
It's in.
So it
Oh, it
is
is?
on the,
On the
yes,
new one.
and many apologies for the confusion. It's clear as I listened what had happened
Okay.
with the various drafts, that final
That you do? Okay.
double didn't get removed. So the motion that Dr. Novak is going to make is the one that is consistent with the agenda, the item that appears on the agenda. And so we'll start with that motion, and then if there is a deviation, we can talk about that.
We'll start with that motion. We'll listen carefully to see if there's any adjustments to amendments to that. Dr. Novak, you're up.
Okay. Mr. Chair, I make the motion, move to approve Ramza Health's request pursuant to Article 8.2 of Ramza's amended and restated franchise agreement dated May 22nd, 2014, to increase the maximum average patient bill for ground ambulance transport within the franchise area of Washoe County from the current allowed rate of $1,526.17 to amount not to exceed $1,950 effective June 1st, 2022, and subject to review December of 2022. Approval shall be contingent on Ramza's commitment to reopen the amended and restated franchise agreement for ambulance services dated May 22nd, 2014, in connection with a process initiated by local governments to discuss regionalization of EMS and fire services, and also Ramza's commitment that during the period of time in which regionalization is actively discussed and pursuant by the local governments, but no longer than 1 year from the approval of this request, Ramza will neither change nor enter into a new agreement with any regional partners for ambulance or dispatch services without first presenting them to the District Board of Health for input and approval. Does that work?
That's motion. Do I have a second on the floor?
Second.
I have a second on the floor. Discussion from the board? Again, there was no public comment. Take the vote. All in favor, say aye.
Aye.
Any opposed? And then please cast your votes. From 6 in favor, 1 against, no abstain, motion passes. Thank you, gentlemen. Look forward to working with you both and all your team. Thank you.
Thank you.
We'll close item 10D, move on to item 11, staff reports and program updates. Mr. Vega.
Thank you, Mr. Chair, members of the board. For the record, Francisco Vega, Director of the Air Quality Management Division. There are a couple things I would like to highlight for you really quickly from my report. The first is the American Lung Association's State of the Air report. If you had an opportunity to take a look at that, you'll see that the American Lung Association gave Washoe County an F when it comes to ozone pollution, and also an F when it comes to short-term particulate matter pollution as well. Furthermore, we ranked 21st in most polluted cities by ozone, and then also 12th in most polluted cities by short-term particulate matter. This grade and these rankings obviously take into account things that we have discussed in the past, like wildfires and things like that. And it is obviously concerning, but again, if you're taking a look at that, these are accurate statistics and data based on the air that you breathe here in Washoe County. So again, it is concerning, but these grades are substantiated, and I don't think should take away from other things that we can do to help improve the air quality in Washoe County. So I'm going to pause there and take any questions that the board might have.
Question for you, Mr. Vega.
Yeah.
How tall and how much does Mr. Young Little Cruz weigh? Congratulations on your son.
Thank you very much. Appreciate that. He's, I believe, 18 inches and was 5 pounds, 12 ounces.
That's awesome. Congratulations to you and your family.
Thank you.
Any questions for Mr. Vega, Vice Chair?
Thank you, Chairman. Mr. Vega, I did have a question for you. I had a constituent through Washoe County did reach out to me in regards to rules in regards to heavy truck hauling within the community about not covering their loads with dust and whatnot. And does air quality participate with hauling companies in regards to, because I know we work with construction companies about their construction sites, but are there health codes or are there air quality codes that would mandate hauling companies to obviously either cover loose gravel or loose dirt road or water that down prior to transport?
Yeah, Commissioner Lucy. Excellent question. I want to make sure I get back to you with accurate information.
Yeah, could you bring me back some information about that? Because I did have some people reach out to me in regards to some of the local aggregate pits and hauling and dirt and rocks on the road and whatnot. And so I think it does fall into an air quality when they're barreling down 395 with open beds of dirt and, being with the construction the way it's going in our community and development, that, does that cause a problem with air quality with dust and, some of the winds that we've seen? So,
yeah, absolutely. And again, I believe our regulations do cover that, but I'll get you specifics on that.
Great. Thank you, Mr. Vega.
Absolutely.
Thank you, Chair.
Yeah, absolutely. Even outside of the broken windshields. I know it was an open bed the other day when flying on the freeway, and it's usually NHP will get them for not covering something. Councilman.
Yes, are these stats mainly, so if we take out the 4 months of our fire season and all that, is it just based upon 7 months or 8 months? Or is this, they're putting it all together knowing we have these fires, we have this craziness, we have all this? And I say that because we always say, well, there's fires and that's why. Or are we doing a little bit better than this because we might, if we took out the fires?
Yeah, thank you for the question, Councilman. It does encompass the entire calendar year. Again, F grade is obviously concerning, but again, even if you remove wildfire smoke, there are periods of time where we do exceed the standards. So you can argue, is an F grade appropriate? Probably not. But are we an A? Probably not as well. And it's really hard to make those, I'll say, distinguish that data, because the fire season really encompasses those periods of time where we would have expect some of those exceedances just in general. So typically what we've seen without wildfires, we are typically seeing, again, probably 3 to 4 exceedances of the standards per year.
Okay, thank you.
Yep.
Any further comments? See none. Thank you, Mr. Vega. Congratulations again. We'll close.
I did have.
Yes. Oh, sorry. Go
I did
ahead.
have one more thing. Sorry, Chair. We did also receive notice from the EPA in regards to the requirement to submit a mitigation plan. And again, this is a good thing. This is the EPA acknowledging the fact that we are being impacted by these exceptional events on a continuous basis. So this is essentially as EPA saying, Washoe County Air Quality, come to us with a plan on how you anticipate to notify the community on these events. And then when these events occur, give us that information so we can try to assess that impact on your compliance with the standards. So again, we'll work together to submit that mitigation plan to the EPA. But again, this is again a good first step from the EPA, just as far as acknowledging that we're being impacted by these events. Yeah.
Dr. Clacken?
Do you expect that would, if we put together the right plan, that our rating then would go to a better position here? I mean, are they going to give us a little room on that or not?
So this is in regards to American Lung Association's grade, is that correct?
Yeah.
The American Lung Association's grade, again, takes into account all the data, whether it's directly impacted by sources within Washoe County or wildfires. So I don't believe this will impact their grade that they provide Washoe County.
Maybe you can educate them on it.
I'll do what I can.
Okay. Thank you, Mr. Vega.
Thank you, Chair.
Item B, Community and Clinical Health Services. Ms. Lotritz.
Lisa Lotritz, Division Director for Community and Clinical Health Services. I just wanted to highlight 2 items from my report. Our divisional update focuses on National Adolescent Health Month. And previously, we had this as Teen Pregnancy Month, but there, as you read, the observance has changed. And just wanted to let you know, we are continuing with walk-in Wednesdays. And despite challenges with staffing, it is very popular, and we have lined this up with early release for Washoe County School District. And so we will continue with that every Wednesday. And then the other thing I want to mention is our last Vaccinate Before You Graduate clinic is on June 7th in Incline Village. And along with this is the preparing the seniors, the incoming seniors of getting the meningococcal vaccine. As of July 1st, they will not get their senior schedule if they do not have it when the school starts in the fall. So we're just trying to get ahead of this. We are preparing for back to school. We have many clinics this summer. And we are keeping in mind that many parents will wait when towards the end of summer to get the meningococcal vaccine. So we will have 2 different scheduling systems, one if they need lots of vaccines, one if they just need meningococcal. So we're just taking all that into account. That's all I have, and I'm happy to answer any questions.
Great. Any comments from the board? See none. Thank you so much, Ms. Lotritz.
Thank you.
We'll close item B, go to item C. Ms. Dixon, Environmental Health Services.
Good afternoon. For the record, Erin Dixon with Environmental Health Services. Just 2 things to highlight in the report in front of you. The program is our public bathing program that is highlighted and additional information provided for you. This was very intentional as our seasonal pools all want to open on Memorial Day. They are, as Lisa said, like parents sometimes wait to the last minute. Sometimes our pool operators wait to the last minute as well. We have had our seasonal opening schedule available since April 1st, so anyone who does call today for a pool opening, we are not going to be able to accommodate that by the weekend. Hopefully the snow that is supposed to be coming will reduce their desire for that. I did want to let you guys, just a few things to highlight, that when we say public bathings, we actually mean swimming pools, spas as in hot tubs, therapy pools, wading pools, spray pools, water slides. All of those are encompassed in the approximately 600 permits that we do have. And that our program follows everything from initial design and construction all the way to operation. Our Temp Foods also is going to be holding some workshops on June 6th and June 8th, both in person and virtual. on some new applications to help with the season, hopefully streamline things and make things easier for everyone. We will also be implementing a new cutoff date for applications for our temp foods. We are getting requests on Friday afternoons for a Saturday event. That doesn't leave us enough time to get staffing. So we will be working with the promoters and the applicants, but we are going to be pushing for a Wednesday close of business for the weekend events. And I also want to really give a shout out to our team that was able to thank you for approving the Swiss board members last time we were here. The Swiss board then met and they brought back both variances that you approved at this board meeting. An impressive timeline, and grateful that they were able to pull that off. All right, so that is it. If you have any questions.
Thank you, Ms. Dixon. Vice Chair.
Thank you. Ms. Dixon, just like, as I asked Mr. Vega, I do have some requests.
Absolutely.
In regards to manure, livestock manure, storage and removal and different things like that, can I get some updates on regards to code as it pertains to like storage of that and how we, from a health district, especially specifically for commercial businesses like riding arenas and stables and whatnot. Can I get, do we have a code on that? And if you do, can you send
Absolutely,
me some?
we can get you some of that information.
That would be great. Thank you. Thank you, Mr. Chairman.
Thank you. Any further comments? Seeing none. Thank you, Ms. Dixon.
All right,
Appreciate
thank you.
it. Item D, Dr. Dow, Epidemiology and Public Health Preparedness.
Hi, good afternoon, Mr. Chairman, members of the board. This is Nancy Dow, Division Director of Epidemiology and Public Health Preparedness. So a few quick highlights for this month. We have issued 5 Epi News this month already so far. May being Hepatitis Awareness Month, we published 3 Epi News related to hepatitis awareness. One on acute hepatitis B, one on hepatitis B vaccination, and one more on hepatitis C. As a reminder, the epidemiology program conducts surveillance for acute cases of hepatitis A, B, and C, as well as chronic hepatitis B and hepatitis C and perinatal hepatitis. The other 2 Epi News that were issued were in order to distribute the Health Alert Network notification from the CDC to providers and the community. On May 11th, a Health Alert Network publication was issued related to updated recommendation on adenovirus testing and report for children with acute hepatitis of unknown etiology. For situational awareness for the boards, to date, there are 216 cases of persons under investigation reported to the CDC from 38 states and jurisdictions. For Washoe County, we had 32 children so far that were brought to our attention to be checked for criteria, either through syndromic surveillance from the state or through provider's alert, and none of these have met case definition. On May 20th, the CDC issued a Health Alert Network notification on the monkeypox virus, which was distributed through our Epi News on the same day. As of this morning, there are 9 cases reported across 7 different states. 5 are monkeypox and 4 are orthopox confirmed, which are treated as monkeypox until confirmation. All cases are of the West African clade, which is a less virulent strain. There are no cases in Washoe County or Nevada right now that we are aware of. And finally, our flu season ended with week 20 last week. We will be producing our seasonal report this Friday. However, as the health officer already just mentioned, our ILI activity and flu hospitalization noted in our surveillance efforts have been increasing, especially in the most recent 2 months. And this is, although not unprecedented, is not usually seen for the flu season. And this trend is not just seen with Washoe County, it's seen across the state and nationally. So the most recent 2 flu seasons have not been typical due to COVID activities and interventions. And given that it's unclear how the influenza activities, rates, and hospitalization will trend moving into the summer, we will continue our flu surveillance and provide reports on a monthly basis for the off-season month until the beginning of the 2020 and 2023 season. That's all my updates. I'm happy to answer any questions you may have.
Thank you, Dr. Dow. Any questions from the board? Councilman?
Yeah, you said monkeypox, which we've been watching all that. Is there anything that, like, is there a vaccine for that particular thing if it does come our way? Is there any?
There's available, there's vaccines available, so for post-exposure prophylaxis that can be administered. There's also antivirals available.
So if something were to happen, like you said, I don't think, it doesn't sound like it's a mass spreader of any concern necessarily, but I know that it's out there. So I get asked by people who know I'm on the health board about it, and I'm like, I don't know anything.
Yes, so if, depending on your risk, depending on your contact level, if you are of the high risk contact, then you can be administered the PEP. And also if you are of moderate, intermediate contact, PEP can be discussed with your provider and with us and CDC for that.
Okay, thank you.
Vice Chair.
Dr. Dow, in regards to the final action plan for the COVID-19 response that you have in the staff report here, it'll be in June. Do you know approximately, can we anticipate it early June or later in the month?
It will be towards the end of the month.
Towards the end of the month, okay. And will that include state statistics as well?
We can include that.
Okay, thank you. I didn't know if you were doing it in conjunction with the state or any of the other counties around here. But I just would, if I could get some information from that when that report comes out, that'd be great. Thank you.
Further comments? Seeing none, we'll close item D. Thank you, Dr. Dow. Appreciate it. Item E, District Health Officer.
Yes, thank you, Chair Delgado. I just wanted to highlight a few things from my report and some additional information. The Board of County Commissioners adopted the county manager's budget that was presented to them on May 17th. And so that is basically the budget that the District Board of Health had approved to provide to the county back in February. One of the unknowns that's just recently been resolved is the collective bargaining agreements with the labor units and the COLA level. So the COLAs in those agreements are at 5% for FY23 and 3.5% for FY24. We had budgeted for a 4% COLA. However, we had also included funds because we thought the OPEB contributions for healthcare for retired employees were going to be going up, and that didn't happen this year. So we have the funds within our budget to cover that COLA increase, that 5% level. So we're all looking good there. On the Title X funding, we did have an opportunity to meet with the Interim Health Committee Chair Peters to inform her. It was a joint meeting that we had with the State Department of Health and Human Services and Carson City Health and Human Services. All of three of us had not been funded for this next 5-year grant cycle with Title V. And so we were discussing our concerns and some possible assistance from the legislature with allowing us to have funding and provisions to continue providing those family planning services. So we're continuing to be active on that front. And then I also just wanted to highlight for the board that next month at the June meeting, we will have the annual board review of the interlocal agreement establishing the health district. So just wanted to highlight that for you so you're thinking about it as far as if there are anything that you want to propose as far as any recommended changes in the interlocal agreement. And that concludes I did include some more information about the therapeutics, so a pretty good table if anybody has interest in that, but I provided most of my COVID update earlier. So happy to answer any questions.
Further comments from the board? Seeing none, we'll close item E. On to board comments. Do we have any board comments from the board?
Chairman.
Yes, Vice Chair.
Couple requests I would make is that, as we've talked about amendments to the franchise agreement today, what I would ask is that this board bring back an amendment to the franchise agreement addressing indigent services for Ramza amongst their franchise agreement, so that we can have those discussions with Ramza and the county to discuss payment and augmenting, subsidizing their budget for those services. And then the other thing I would offer is that I would like to bring back a discussion amongst this board in regards to changes in the approval process for our development code. Realistically, the challenges with our review process in the commercial and residential space, that there were delays that have impacts on construction within our community, and that if there are some anticipated abilities for, if staff gets beyond a certain time limit, that those permits are either just granted, just very similar to the U.S. Army Corps of Engineers, that if nothing is responded to or no substantive changes have been submitted to the individual, that they would be just deemed approved. So something of that nature, so that we can ensure some, expedient, more review process for the agency. I know I've had conversations with the health district officer in regards to, taking that out, the health, and bringing, not taking out health of the actual review process, but allowing the review of health code being done within the respective agencies. And he's informed me that that is challenging and not beneficial. But what I would do, if that is not the case, is if we can bring it back for discussions about revamping the way we approach our policy, that if to address the long review times for commercial and residential development, to allow that if they do not get a substantive review process or response from our agency, that they are within a reasonable amount of time, that they are deemed approved. So something to that effect. But I would like to work with you and the district health officer to work on some potential policy changes for that, sir. Thank you.
Thank you. Any other comments from the board? Seeing none, we'll close board comments. We already took public comment at the beginning, so I'll look for an adjournment. Got a motion, and a second. All in favor? Thank you all very much.
Aye.